Wow. You really weren't kidding about getting right into some real medical emergencies.
Yeah.
The audio you found puts us right in the middle of two intense situations.
Yeah.
Uh, on one side, we've got a woman struggling with what seems like a really bad asthma attack.
Mm.
And then on the other side, a man facing a possible cardiac event. And it sounds like it might be from missing dialysis.
Mm-hmm.
What I find so interesting is we get to hear medical professionals, like, think on their feet, you know,
Right.
making these big decisions with not a whole lot to go on at first.
It really is.
Yeah.
It's like they're solving a puzzle in real time.
Oh, totally.
Gathering clues from what the patient's telling them, how they look, any vitals they can get,
Right.
and all while they're trying to like stabilize the patient.
It's pretty amazing.
So let's start with this first scenario with the woman, Jennifer. She's clearly in distress, like every breath.
Yeah.
The struggle. You can just hear it.
You can tell right away how serious this asthma attack is.
Yeah.
And that's why Shannon, the medical professional there,
Jumps right to the Ventolin.
Oh,
Albuterol.
Oh, yeah.
It's the go-to rescue inhaler for a reason.
So why Ventolin specifically? Is it just the fastest acting?
It is.
Okay.
It's the fastest.
Okay.
Basically, it relaxes the muscles around the airway, so it opens everything up and makes it easier to breathe.
Mm-hmm.
What's interesting, though, is how they're giving it to her.
Yeah, I was going to ask about that.
8 puffs every 4 breaths through an aerochamber and a mask.
8 puffs. That seems like a lot.
Yeah, and that alone tells you how serious her attack is.
Wow.
And the aerochamber and the mask are important, too. It makes sure the medicine gets deep into the lungs where it needs to be.
Oh, I see.
You wouldn't believe how much medicine gets wasted if you don't use an inhaler.
So, like, every detail really does matter.
Absolutely.
Now, I also noticed they gave her dexamethasone orally.
Mm-hmm.
That's a steroid, right?
You got it. It is
Yeah.
a steroid.
Okay.
But it's all about tackling that inflammation that's making the asthma attack so bad.
Okay.
So think of it as a longer-term solution.
Okay.
The Ventolin opens things up right now.
Right.
The dexamethasone is trying to prevent it from flaring up again.
Oh, that's smart.
It's a good 1-2 punch.
Yeah.
Take care of the immediate problem, but also work on the root cause.
Yeah, like manage the crisis and also manage the underlying condition.
Exactly.
I like that.
Yeah.
And something else I noticed is how much they're checking in with each other.
Oh, yeah.
Like, does that sound all right? Are we good with this? It's just really cool to hear them working together so well.
Oh, it's so important, especially in a situation like this.
Yeah.
It really reduces the chance of any errors and makes sure everyone's on the same page. Because remember, we're talking about some pretty serious medications here.
Right.
Precision's key.
Totally. All right, let's switch gears to that second scenario now.
Okay.
The 60-year-old man with the potential cardiac event.
Yep.
We know he's diabetic and has missed some dialysis appointment.
Yeah.
Can you explain, like, why is that so dangerous?
Absolutely. So when someone with diabetes misses dialysis,
Okay.
waste products start to build up in their blood.
I see.
One of the biggest concerns with that is potassium.
Okay.
High potassium levels, or what we call hyperkalemia, can really mess with the heart's rhythm.
Oh, wow.
It can be really dangerous.
So it's not just about filtering out toxins.
Right.
It's also about maintaining the balance of electrolytes, too.
Exactly. You need to keep things in balance.
Okay.
Think of it like this. The heart needs a certain balance of electrolytes, like potassium, to keep its electrical activity going smoothly.
Okay.
But if you get too much potassium, it throws the whole thing off.
Oh, wow.
And then you can get some really dangerous, irregular heartbeats.
And that makes the medical team's response even more fascinating. They go straight for epinephrine, a full ampule.
Yeah, epinephrine or adrenaline, as some people call it.
Right.
It's like a jolt to the system, you know?
Yeah.
It can speed up the heart rate and increase blood pressure. It can really help stabilize someone whose heart is in trouble.
And then they also give him calcium gluconate, but much more slowly over a few minutes.
Yeah, this is where things get interesting.
Okay.
Calcium gluconate basically protects the heart muscle from the effects of that high potassium.
So why the slow administration?
Well, giving calcium gluconate too quickly can cause its own problems, especially for the heart. So it's all about finding that sweet spot.
Okay.
Protecting the heart from the potassium, but not doing more harm with the treatment itself.
So it's like this balancing act.
Yeah, exactly. A high wire act.
Yeah.
trying to find the best possible outcome for the patient.
And in the middle of all this, they're taking the time to talk to the patient's relative,
Right.
who seems really worried, understandably.
Of course.
And they do a good job of explaining what's happening,
Yeah.
like in simple terms, trying to reassure them
Right.
without downplaying the seriousness of the situation.
It's a tough balance.
Yeah. It's amazing how they stay so calm and focused with everything going on.
Well, that comes with experience.
Yeah,
They've seen pretty much everything at this point.
right.
And they've developed a real sense of how these situations tend to play out.
Mhm.
But it's not just instinct.
Right.
They have years of training study practice
hmm
that lets them make those split-second decisions.
That's wild. It's amazing.
It is.
Yeah. It's pretty amazing, to hear these emergency medications being used
Mhm.
like in a real situation.
Oh, yeah.
It really brings home how complex it all is
Definitely.
and how quickly things can change.
Absolutely.
But through it all, what really gets me is how they never lose their cool.
Mm-hmm.
And they remember that they're dealing with a person.
It's so important.
Like in the first scenario, they're explaining everything to Jennifer as they go,
Right.
like reassuring her,
Yeah.
making her feel involved, even though she's struggling to breathe.
It can make such a difference.
Yeah.
And then in the second case with the cardiac event, they take the time to talk to the relative. Right.
Explain things clearly and with empathy.
Yeah, it would be so easy to just focus on all the technical stuff
Oh, totally.
and forget about the human side of it.
But they do a great job.
Yeah, these scenarios also highlight something we don't always think about,
What's that?
just how crucial communication is in healthcare.
Oh, absolutely. Every detail matters.
Yeah.
You hear them confirming medications, dosages, routes of administration. It's like a carefully choreographed dance.
It's like a system.
It is.
And it's not just about preventing errors either.
No, it's also about building trust,
Right.
making sure everyone's working together seamlessly.
Yeah, everyone contributing their expertise.
Exactly.
A real team effort.
To get the best possible outcome for the patient.
That's the goal.
It's interesting to compare the two cases.
Oh, yeah. How so?
Well, with Jennifer, it seemed like they knew what they were dealing with pretty quickly.
Mm-hmm.
But with the cardiac event, it's more of a mystery.
That's a good point.
They have to figure things out as they go.
Yeah, with the asthma attack, they could see the difficulty breathing. They could hear the wheezing.
Right.
The diagnosis was pretty clear.
Okay.
But with the cardiac event, they had to piece together the clues,
Mm-hmm.
the missed dialysis, the patient's history, the symptoms.
Wow.
It was real detective work.
So they're gathering evidence, making a hypothesis, and then they have to act on it.
Under pressure.
That's wild.
Hmm.
It makes their calmness even more impressive.
Well, that's where the training and experience comes in.
Yeah.
They've been in these situations before. They've practiced their responses.
Hmm.
They know how to think clearly, even when the adrenaline's pumping.
It also makes me think about how important patient history is.
Absolutely.
Like knowing that the man had missed dialysis appointments.
Right.
That was crucial for guiding their treatment.
It was a huge red flag.
Yeah.
It told them right away that hyperkalemia was a real possibility.
It's a good reminder that we as patients play a big role in our own healthcare.
Couldn't agree more.
Like we need to be honest with our doctors.
Mm.
Tell them everything, even if it seems small.
Sometimes those little details can be the key
Yeah.
to getting the right diagnosis and the right treatment.
It's like these recordings are challenging us to be more involved in our own healthcare.
I think that's a great way to put it.
We shouldn't just be passive.
Right.
We should be asking questions, understanding our conditions.
And advocating for ourselves.
Exactly. And recognizing the expertise of the professionals who are there to help us.
Absolutely. These scenarios really show the human side of medicine.
Yeah.
These are real people dealing with real challenges.
Making life or death decisions.
every single day. And they do it with incredible skill and compassion.
It's pretty inspiring.
It is.
It's amazing we've learned so much just by listening to these medical professionals at work.
It really is like a crash course in emergency medicine,
Yeah.
We're hearing how they make decisions, what medications they use,
Right.
the dosages, the attention to detail. It's fascinating.
Yeah, before this audio, I knew emergency medicine was intense.
Mm.
But I don't think I realized how much precision goes into it.
Yeah, it's not just about rushing in and doing those dramatic procedures.
Right, like on TV.
Exactly.
Yeah.
It's more about careful assessment planning and execution.
Right, and that constant communication, making sure everyone's in the loop, working together.
Yeah, it's a well-oiled machine.
We really see all those elements in these scenarios.
Definitely.
It highlights just how much is going on behind the scenes.
During a medical emergency.
Yeah. These recordings also make you think about your own healthcare.
In what way?
Well, instead of just being passive,
Uh-huh.
we can be more active.
Right.
asking questions, understanding our conditions.
Advocating for ourselves.
Exactly, and recognizing the expertise of the people who are there to help.
That's key. They're not just experts.
Right.
They're individuals who are really dedicated to helping others.
These recordings give us a glimpse into their world,
Yeah.
their thought processes, the challenges they face.
It's a good reminder
It is.
that behind every medical intervention,
Yeah.
there's a whole team of people working really hard to provide the best care possible.
So as we wrap up our deep dive into these medical emergencies,
Mhm.
I want to leave you with something to think about.
Okay.
How might hearing these scenarios change how you approach medical information in the future?
Interesting.
Will you be more likely to ask questions or speak up about your concerns?
It's a good point. The world of medicine can be confusing,
Right.
even intimidating. But when we listen to these real-life scenarios,
Yeah.
we get a better understanding of how things work.
We see the human side of it.
Exactly. The thinking, the actions, the dedication of these professionals on the front lines.
So who knows, maybe this deep dive will inspire you to learn more about a specific condition.
Or a treatment.
Yeah, or even consider a career in healthcare.
You never know.
Until next time, keep exploring, keep learning, and keep diving deep. All right, so picture that you're on scene, lights are flashing, and your patient is looking a little green around the gills.
Oh, yeah.
Maybe they're even well tossing their cookies.
You've got to act fast.
You need to act fast.
Yeah.
But just grabbing any anti-nausea medication could actually do more harm than good.
Right.
So how do you, as a paramedic, make the right call?
That's a good question.
That's what we're diving deep into today on Dancitron, that's Zofran for you, and Dimenhydrinate, a.k.a. Dramamine. We're going to break down how they work, the pros and cons,
Yep.
and maybe even a few surprising facts along the way.
Sounds good.
So to really understand these medications, we need to start with the basics.
Yeah.
What is actually happening in the body when someone experiences that awful feeling of nausea followed by, vomiting?
Right. So we kind of have to go back to Biology 101.
Okay, so back to Biology 101, but seriously, why is it so important to understand the nitty-gritty of nausea and vomiting?
Because simply masking the symptoms might not address the root cause, which is critical in providing effective care.
Right.
Nausea is that queasy feeling, while vomiting is the body's forceful way of expelling stomach contents.
Right.
And here's where it gets interesting. Serotonin,
Okay.
that neurotransmitters often associated with mood, plays a key role in both.
Hold on, serotonin. I thought that was the happy chemical.
Right. It turns out serotonin wears many hats.
Okay.
When you ingest something toxic or irritating, your gut actually produces more serotonin to, shall we say, expedite the removal process.
So it's like serotonin is the guts bouncer kicking out anything that's causing trouble.
Exactly. And that same serotonin also triggers the vomiting center in the brain, leading to, you guessed it, nausea and vomiting.
Okay, so it's not just about stopping the symptoms. It's about figuring out why the body is hitting the eject button in the first place.
Yep.
And that's where knowing your medications like Dimenhydrinate and Ondansetron becomes absolutely crucial.
Absolutely. Let's start with Dimenhydrinate.
Okay.
This one belongs to a family of medications called anticholinergics.
Anticholinergics. I'm getting flashbacks to pharmacology class.
Oh, yeah.
Can we break that down in a way that doesn't make my head spin?
Sure. Think of our nervous system as a complex communication network with chemical messengers relaying signals throughout the body.
Okay.
One of these messengers is acetylcholine.
Okay.
Anticholinergics, like Dimenhydrinate, block acetylcholine from doing its job in specific areas.
So it's like cutting off communication lines in certain parts of the body, right?
Precisely.
Yeah.
And that's how Dimenhydrinate helps with motion sickness and inner ear issues.
Yep.
It targets those H1 receptors that are going haywire and sending all those dizzying and nauseating signals.
Makes sense. But as with any intervention, there's always a flip side. What about side effects?
Of course, drowsiness, headaches, dizziness, these are all potential side effects paramedics need to be aware of.
Yeah, for sure.
There's also the risk of overdoses, especially if it's combined with other anticholinergic drugs.
Oh, wow.
Thorough patient assessment is key.
Here's a little insider tip from the research, something to keep in mind on your next shift.
Oh.
Did you know Dimenhydrinate needs to be diluted for IV use? Apparently, it can be quite irritating otherwise. Makes sense when you think about a patient already feeling terrible.
It's those small details that can make a big difference in patient comfort and care.
And speaking of important details, there's a new age restriction on Dimenhydrinate. It's no longer recommended for patients over 65.
Yeah, That's because older adults naturally have lower levels of acetylcholine, making them more susceptible to the side effects of anticholinergics.
Oh.
So using it in this population can be a bit like adding fuel to the fire. It's all about using these medications safely and effectively, considering individual patient factors.
So let's say you arrive on scene and your patient is experiencing that classic motion sickness nausea. Dihydrogenate seems like a good option in that scenario, right?
Absolutely. Its effectiveness against motion sickness and inner ear problems makes it a go-to choice in those cases.
Okay.
But now let's shift gears and talk about ondansetron, our serotonin blocker.
Right.
This one works a little differently.
All right, hit me with it. How does ondansetron tackle those nasty nausea signals?
Ondansetron blocks the release of serotonin in both the gut and the brain.
Okay.
Essentially, it's like intercepting those panicked "I feel sick" messages before they reach their destination.
So less serotonin equals less nausea and vomiting.
Exactly.
And one of the things I find fascinating about ondansetron is how quickly it works, especially the orally disintegrating tablet.
Yeah.
It's like instant relief.
That's right. It bypasses the whole swallowing process, which can be a big plus for patients who are struggling.
Right.
And it provides relief for a reasonable amount of time.
Okay.
But as with most medications, there's a catch.
I was wondering when the but was coming. There's always a catch, right?
Right.
Fill me in.
Ondansetron can interact with other medications that increase serotonin levels,
Okay.
and that interaction can potentially lead to something called serotonin syndrome.
Serotonin syndrome. That doesn't sound good.
It can be quite serious. We're talking headaches, agitation, confusion, and even seizures in severe cases. So it's vital for paramedics to be aware of this risk and monitor their patients closely, especially those taking medications that might boost serotonin levels.
Our research also mentions some specific contraindications for ondansetron things paramedics need to be absolutely sure they're checking for.
Yes, one example is apomorphine, which is used to treat Parkinson's disease.
Right.
Combining the two can cause a dangerous drop in blood pressure.
Oh, wow.
So if a patient is on apomorphine, ondansetron is definitely off the table.
And then there's the whole issue of ondansetron and potential heart problems. That seems like a pretty big deal.
It is. The research mentions QT prolongation, which is essentially a change in the heart's electrical activity.
Right.
In rare cases, this can lead to a dangerous heart rhythm called torsades de pointe.
So even if a 12-lead EKG isn't always possible in the field, paramedics need to be really cautious and use their judgment when considering ondansetron.
Absolutely. It's about weighing the potential benefits against the risks based on each patient's unique situation and medical history.
Okay, so let me get this straight. We've got dihydrogenate, which tackles those H1 receptors and excels at handling motion sickness.
Mm-hmm.
Then we've got ondansetron, the serotonin blocker, which is super fast-acting and useful in a broader range of scenarios.
Yeah.
But it comes with the risk of some potentially serious side effects and interactions.
Right.
This is where a paramedic's expertise and critical thinking skills really come into play, right?
You nailed it. Choosing between these two medications is rarely black and white.
Right.
It's about considering the whole picture, the patient's age, other medications they're taking, the suspected cause of the nausea and vomiting. It's all connected.
It sounds like paramedics are playing a high-stakes game of medical clue.
Kind of.
They have to piece together all these clues to make the right call for their patient.
And let's not forget the human element.
Yeah.
You're not just dealing with a set of symptoms. You're dealing with a real person who's scared, uncomfortable, and looking to you for help.
Yeah.
Sometimes a reassuring voice and a calm demeanor can be just as powerful as any medication.
That's such an important point. It's not just about the science, it's about the art of caregiving.
Exactly.
So to sum it up so far, we've covered how dihydrogenate and ondansetron work, their pluses and minuses,
Yep.
and some scenarios where one might be a better choice than the other.
Right.
But we're not done yet.
Nope.
In part 2, we'll dive even deeper into the practical considerations for paramedics, exploring real-world scenarios and some of the toughest decisions they face in the field. Stay tuned.
Can't wait.
Welcome back to the Deep Dive. We're right in the thick of things, talking about 2 common medications paramedics use to combat nausea and vomiting, dihydrogenate and ondansetron. Before the break, we were discussing how paramedics have to channel their inner medical detective, gathering clues and weighing risks to make the best call for each patient.
Right.
It's not just about knowing the drugs, it's about understanding the whole person.
Exactly.
But what happens after that initial decision is made?
That's where things get even more interesting. Paramedicine isn't a set it and forget it kind of job. Administering a medication is just the first step. The real skill lies in the ongoing assessment and reassessment.
Oh, okay.
observing how the patient responds and being ready to adapt if things aren't going as planned.
So it's like you're constantly monitoring the situation, looking for any signs that things are improving or, taking a turn for the worse.
Precisely. Let's say you've given a patient ondansetron for severe nausea and vomiting.
Okay.
You're not just going to assume it's working perfectly.
Right.
You're watching for signs of improvement, like a decrease in nausea or the number of vomiting episodes.
And at the same time, you're keeping an eye out for any of those potential adverse reactions we discussed earlier,
Yeah.
like serotonin syndrome or QT prolongation. Those are red flags you can't afford to miss.
Exactly. And if the initial treatment isn't hitting the mark, you need to be ready to switch gears.
Okay.
That might mean trying a different medication, like dimenhydrinate, if ondansetron isn't doing the trick. Or it might mean considering other interventions based on the patient's specific needs. It's all about being adaptable and thinking on your feet.
Which brings us back to that crucial point you made earlier. Paramedicine is incredibly dynamic. You have to be able to roll with the punches and make the best decisions possible, even when you're dealing with limited information and a ticking clock.
It's that ability to think critically, solve problems in real time, and remain flexible that makes paramedics so invaluable in emergency situations.
I can imagine.
They're the MacGyvers of the medical world.
Okay, I love that analogy. But speaking of things that can be a bit tricky, we've talked about the potential risks associated with these medications.
Yeah.
Particularly ondansetron and its effects on the heart. This seems like an area where paramedics need to be extra vigilant, wouldn't you say?
Absolutely. As we touched on before, ondansetron can cause QT prolongation,
Right?
which can be a precursor to a dangerous heart rhythm called torsades de pointes.
Right.
It's a rare occurrence, but it's still a very real concern, especially when you're dealing with patients who already have heart problems or are taking other medications that can also prolong the QT interval.
So knowing this, what steps can a paramedic take to minimize those risks and make sure they're not inadvertently making things worse?
Well, it all starts with a thorough patient assessment.
Okay.
That means gathering as much information as possible.
Yeah.
Medical history, current medications, allergies.
Right.
It all paints a clearer picture of the patient's overall health and helps identify any potential red flag.
It's like you're putting together a giant puzzle, and each piece of information brings you closer to understanding the full picture.
Exactly. And then there's that ongoing monitoring we talked about.
Right.
Even if a paramedic decides to go with ondansetron,
Okay.
they're going to be watching the patient like a hawk for any signs of trouble.
Like what?
Changes in heart rate or rhythm, dizziness, fainting. Those are all warning signs that something might be wrong.
And in situations where you can't do a 12-lead EKG, which is often the case in the field, a paramedic's clinical judgment becomes even more critical.
It's true. They have to rely on their training experience and their gut feeling to decide whether ondansetron is safe for that specific patient and whether any additional precautions need to be taken.
It's a lot of pressure, but it's also pretty amazing to think about the impact paramedics have.
Yeah.
They're out there every day making these tough calls and literally saving lives.
They are true heroes, no doubt about it.
So as we wrap up this part of our deep dive, I want to take a moment to acknowledge all the paramedics out there on the front lines making those split-second decisions that make a world of difference.
Hear, hear.
But before we jump into the final part of our exploration,
Mm-hmm.
I will leave you with a question to ponder.
Okay.
Think about everything we've discussed so far. The mechanisms of action, the pros and cons, the potential risks.
Yeah.
And put yourself in the paramedic's shoes. If you were facing a patient experiencing nausea and vomiting, what factors would you consider when choosing between ondansetron and dimenhydrinate? It's a decision that requires careful thought and a deep understanding of both the science and the art of paramedicine. Welcome back to the deep dive. I hope you've had some time to think about that question I left you with.
Ooh.
What goes through a paramedic's mind when choosing between ondansetron and dimenhydrinate for a patient feeling queasy?
Right.
It's not as simple as just picking a name out of a hat.
Oh.
It's about weaving together all the threads we've been discussing, the science, the patient's individual needs, and a whole lot of on-the-spot critical thinking.
It's a decision that highlights the complexity of paramedicine. There's no magic formula or one-size-fits-all answer.
Right.
It's about weighing the potential benefits of each medication against the possible risks, all within the context of the individual patient.
No two situations are exactly alike.
Exactly.
So it's about taking all that textbook knowledge and applying it in a way that makes sense for the person right in front of you. It's about adapting to the ever-changing environment of the field.
Exactly. And that's what makes this profession so challenging and, let's be honest, pretty darn exciting.
Okay, let's put this into practice.
Okay.
Imagine this. You roll up on a scene And there's a young adult who looks like they're about to lose their breakfast again.
Oh, boy.
They're pale, sweating, and just plain miserable. What's the first thing you do?
First things first.
Okay.
You need to get a history from the patient if they're able to talk to you.
Okay.
What led up to this? Have they eaten anything unusual? Do they have any underlying medical conditions? Are they on any other medications, even over-the-counter stuff? All those details matter.
So you're not just treating the nausea and vomiting, you're trying to unravel the mystery of what's causing it in the first place.
Exactly. It's like being a medical detective, piecing together the clues to get to the root of the problem. And then, of course, there's the physical assessment.
Okay.
You're checking vital signs, listening to their heart and lungs, looking for anything that might give you a hint about what's going on.
Let's say our patient mentions they have a history of migraines, and you notice they're sensitive to light and sound. Could that push you toward choosing dimenhydrinate?
Potentially, yes. We know dimenhydrinate is effective for those vestibular issues, that inner ear stuff that can sometimes be tied to migraines.
Right.
So in that case, it might be a better fit.
But then what if they also mention they're taking an SSRI, an antidepressant that can increase serotonin levels? Now suddenly ondansetron might be off the table because of that risk of serotonin syndrome we talked about.
It's a constant process of evaluation, gathering information, and reassessing. You have to stay flexible and adjust your approach as you learn more about the patient.
This really underscores why it's so important for paramedics to stay on top of the latest research and guidelines. The medical world is constantly evolving.
Couldn't agree more. Being a paramedic is a commitment to lifelong learning.
And speaking of learning, let's shift gears for a moment and talk directly to our listener. If you ever find yourself in a situation where you're experiencing nausea and vomiting, what can you do to help your healthcare providers make the best decisions for your care?
Be honest and upfront about your symptoms, your medical history, and any medications you're taking, even those over-the-counter remedies or supplements. The more information you can provide, the better equipped your healthcare team will be to make informed decisions.
Remember, you're not just a passenger in the ambulance, you're the co-pilot. Speak up, ask questions, and be an active participant in your healthcare journey.
Well said.
As we wrap up this deep dive into the world of ondansetron and dimenhydrinate, I'm struck by the complexity of what paramedics do every day. They're out there on the front lines making life-saving decisions in high-pressure situations. It's a profession that demands both scientific knowledge and a deep understanding of human compassion. And to our listeners, I hope this exploration has given you a new appreciation for the intricacies of pre-hospital care. Remember, there's always more to learn, more to discover, and more ways to advocate for your own health and well-being. Stay curious, keep asking questions, and never underestimate the power of informed decision-making. Until next time, thanks for joining us on The Deep Dive.
All right, strap in, everybody. Today, we're going deep on something pretty intense. Using oxytocin in emergency childbirth.
Oh, wow.
Yeah.
Intense is right.
You might be thinking, oxytocin, that's the love hormone, right? It's a whole lot more than that, especially when you're talking about paramedics dealing with postpartum hemorrhage.
Right.
We're digging into some serious paramedic training materials to figure this out. So let's jump right in.
Okay, so you're not wrong. It's
Yeah.
definitely more than just those, warm, fuzzy feelings. When we're talking about this kind of scenario, think of oxytocin as like the uterus's best friend.
Okay.
Keeps those muscles in check. It's a hormone our body makes naturally, but paramedics also use a synthetic version, like Pitocin
Okay.
or Syntocinon.
So it's like giving the body's natural process a little boost, right?
Yeah.
But why is that so crucial in an emergency?
Well, think about what happens during labor.
Yeah.
Those contractions, they get stronger and stronger, and that pain, believe it or not, it actually triggers even more oxytocin release.
Really?
Yeah, it's this wild feedback loop that, eventually leads to delivery.
Wow.
Now, imagine if that whole process isn't working quite right after the baby is born. That's where postpartum hemorrhage comes in.
Okay.
And that can be, it can be really serious.
So how often does this actually happen? Like, are we talking about a rare thing, or is this
Yeah.
something that, comes up a lot?
So postpartum hemorrhage, it affects something like 3% of vaginal deliveries.
Okay.
That might not sound like a huge number, but when it happens, it's every second counts.
Yeah.
And actually, in about 20% of those cases, it's caused by something called uterine rupture or even inversion.
Whoa, whoa, whoa. Back up.
Yeah.
Uterine rupture. Inversion. What in the world are we talking about here?
Okay, so uterine rupture, basically, it's a tear in the wall of the uterus.
Oh, no.
Yeah, and that obviously can cause some really massive bleeding.
Yeah.
And the uterine inversion, that's when the uterus it basically turned it inside out.
Oh, my.
So
Well,
think of it like if you push in the bottom of a balloon,
oh, okay.
kind of flips inside out.
Gotcha.
Both of those situations, incredibly dangerous,
Right.
and you need to act fast.
So oxytocin, it's basically the hero in these scenarios then, right?
Yeah, pretty much.
Yeah.
It can literally be the difference between life and death for the mother.
Wow.
And that's why even the World Health Organization is fully on board with using it.
Really?
They recognize how effective it can be at controlling this postpartum hemorrhage.
Interesting.
It's so important, in fact,
Yeah.
that paramedics are trained to administer it immediately after the placenta is delivered.
So walk me through this. How are they actually giving it out in the field?
It's actually pretty straightforward. It's a single intramuscular injection,
Right.
10 units to be exact.
Okay.
Now, this is important because it's different from how oxytocin is used in a hospital setting.
Right, right. You're talking about labor induction, right?
Right.
Like when they
Yeah.
use the IV drip and all that.
Yeah, and that's something that paramedics would never do. Foregut administration of oxytocin requires very, very careful monitoring.
Right.
And it's really reserved for hospitals. In the field, it's strictly IM.
Got it. Safety first.
Always.
Now, I know there are some situations where, even with all its benefits, oxytocin is a no-go. What are those big red flags that paramedics are watching out for?
The biggest one, hands down, is an undelivered fetus.
Oh, wow.
Yeah, this is especially critical if there's been no prenatal care and they don't know if there's more than one baby.
Oh, my gosh.
Giving oxytocin before all the babies are delivered, that could have disastrous consequences.
That's scary.
Yeah.
Are there other situations where it's just too risky to use?
High blood pressure is another one.
Okay.
If the mother's systolic blood pressure is over 160 mmHg, using oxytocin could actually make things worse.
Oh, wow.
Yeah, and it's also off limits if the mother has preeclampsia or eclampsia.
Right.
Those are both really dangerous conditions related to high blood pressure during pregnancy.
And of course, any known allergy or sensitivity to oxytocin means it's a hard pass.
Yeah, absolutely. And speaking of potential problems, what about side effects? Even if it's given correctly, are there things paramedics need to watch out for?
That's a great question.
Even though the intramuscular dose is generally considered safe, it's super important to monitor the mother's blood pressure, both before and after giving oxytocin.
Okay.
Any sudden drops in blood pressure, what we call hypotension, could signal hemorrhagic shock,
Oh, no.
meaning the bleeding is very severe and needs immediate attention.
Okay, so low blood pressure, that's bad. What about if it goes up?
Well, high blood pressure or hypertension could be a sign of a serious vascular issue.
Oh.
So paramedics are trained to recognize these changes and respond accordingly.
So it's not just about giving the shot, it's about being a detective almost.
Exactly.
Looking for all the clues.
They're constantly assessing and reassessing the situation, looking for those subtle signs that something might be wrong.
There's a lot of skill involved.
There definitely is. Now, speaking of putting the pieces together, have you heard of the 4 T's of postpartum hemorrhage?
I think I've heard whispers of the 4 T's. Sounds like a handy way to remember the main culprits.
It is. The 4 T's, they stand for tone, tissue, trauma, and thrombin.
Okay.
Each one represents a different potential cause of the bleeding. And understanding all 4 of them really helps the paramedics make the right call.
So tone, that's got to be related to the uterus not clamping down properly, right?
Exactly. We call that uterine atony,
Uh-huh.
basically a lack of muscle tone in the uterus. It's one of the most common causes of postpartum hemorrhage.
Yeah.
And it's where oxytocin really shines, helps that uterus clamp down and stop the bleeding.
So oxytocin is the answer to the tone problem. What about tissue? What does that refer to?
Tissue, that's anything that's left behind in the uterus after the placenta is delivered.
Oh, okay.
Sometimes little fragments of the placenta or other products of delivery can remain in there.
Oh, yuck.
Yeah, not ideal. And it prevents the uterus from contracting fully, which obviously can cause bleeding.
And trauma. I'm guessing that one's pretty straightforward.
It is. Basically, any tears or lacerations that happen in the cervix or vagina during delivery,
Right.
those can be a big source of bleeding too.
Okay, last but not least, thrombin. Is that related to the blood's ability to clot?
Bingo.
Oh.
Thrombin refers to bleeding disorders or missing clotting factors. So in these cases, even a small injury can cause excessive bleeding because the blood just isn't clotting the way it should.
So even though oxytocin can be a lifesaver, it's not the only thing paramedics have to consider, right?
Oh, absolutely not. Understanding those 4 T's is like having a mental checklist.
Yeah.
It helps them narrow down the cause of the bleeding and really choose the best course of action.
This has been a fascinating deep dive so far. We've covered a lot.
Yeah.
But before we move on, I'm curious, what else are paramedics considering in those moments after a baby is born? I mean, it sounds like there's a lot more going on than just the 4 Ts.
Oh, yeah, for sure.
Okay.
There's a whole lot more to it.
Like what? Give me an example.
Well, first and foremost, they're getting the big picture of the mother's condition.
Okay.
So they're not just checking her blood pressure,
Yep.
they're also looking at her heart rate, how she's breathing,
Yeah.
even her mental state.
Real.
Yeah. They need to know if she's alert and responsive or if she's drifting in and out of consciousness.
So it's like this rapid fire assessment, gathering all those vital signs to figure out how stable she is.
Exactly. And here's something that might surprise you. Accurately assessing blood loss. It can be trickier than it seems.
Really? I would think that it would be pretty obvious if someone was hemorrhaging.
Sometimes it is, but not always. The bleeding might be internal, or the amount of blood you see. It might not actually reflect how serious the situation is.
So how do they figure out how much blood she's lost? That seems like pretty critical information.
It is, and they use a combination of visual cues and their clinical judgment.
Okay.
So they might look at how much blood has soaked through the pads or linens, but they're also considering her symptoms. Is she feeling dizzy or weak? Is her skin pale and clammy? Those are all signs that suggest a significant amount of blood loss.
So they're putting it all together, like a medical detective.
Exactly.
Yep.
And it's a lot of pressure,
I bet.
especially because they're also providing supportive care at the same time.
What does that involve in a postpartum hemorrhage? What are they actually doing while they're trying to figure out what's going on?
It's all about stabilizing her. They're making sure she's getting enough oxygen, keeping her warm, and if needed, starting an IV for fluid resuscitation.
Okay.
Remember, severe blood loss can lead to shock,
Right.
so they need to replace those fluids quickly.
It's amazing how much they're juggling at once.
It is.
It's not just stopping the bleeding. They're literally keeping all these other bodily functions going at the same time.
Exactly. And remember, all of this is happening while they're also trying to get her to the hospital as fast as possible.
Talk about a high-pressure job.
Yeah.
It really makes you appreciate all the expertise and quick thinking that these paramedics have to have.
They do.
So let's say they've given the oxytocin, they're monitoring her vitals, providing supportive care. What else is in their toolkit? Is it just a matter of getting her to the hospital ASAP?
Well, getting to the hospital is definitely the priority, but there are other things they can do to try to manage the bleeding.
Okay.
One technique they might use is uterine massage.
I've heard of that. It sounds pretty self-explanatory.
Yeah.
Are they literally just massaging her uterus?
They are. It involves applying firm pressure to the mother's abdomen
Okay.
to encourage the uterus to contract and expel any tissue that might be retained in there.
Oh, interesting.
It can be very effective at controlling the bleeding.
That's pretty amazing. What other techniques might they use?
Another option is something called a uterine balloon tamponade.
Okay, that one sounds a little more involved.
It's actually a pretty clever device. It's a special balloon that's inserted into the uterus and then inflated with sterile fluid.
Oh, wow.
And the balloon puts pressure on the bleeding vessels from the inside, which helps to control the hemorrhage.
Wow, it's like they're bringing a whole operating room to the scene.
Pretty much.
It seems like paramedics have a surprisingly wide range of options to deal with these emergencies.
They do.
Yeah.
And the choice of which technique to use really depends on the situation.
Uh-huh.
How severe the bleeding is,
Yeah.
the mother's overall condition. It's all about making the best judgment call based on the information they have at the moment.
This is so fascinating. It's really eye-opening to see all the complexities involved in something like childbirth.
Yeah.
I never realized how much expertise goes into managing those really critical moments.
It's definitely more complicated than it seems on the surface.
Right.
And it's important to remember, too, that we're focusing on the emergency side of things here.
Yeah,
Most births go smoothly, and all these interventions aren't needed.
that's reassuring.
Yeah.
But it's definitely good to know that paramedics are prepared to handle those tougher situations.
Absolutely. They're highly trained professionals, and they play such a vital role in ensuring the health and safety of both the mother and the baby.
Totally agree.
But beyond all the technical skills and medical knowledge,
Yeah.
there's another really crucial aspect of your role that we shouldn't forget.
Oh. And what's that?
It's the human element.
Yeah.
Amidst all the urgency and the medical procedures,
Mm-hmm.
it's really crucial to remember that childbirth is a deeply personal and emotional experience.
That's so important. It's easy to get caught up in all the technical details.
Yeah.
And forget about the human side of things.
Exactly. So While it's vital for paramedics to have all the knowledge and skills to manage these complications,
Right.
it's equally important for them to approach each situation with compassion,
Yeah.
empathy,
Uh-huh.
and respect for the mother's experience.
That's beautifully said. I think that's the perfect place to pause for a moment and reflect on everything we've learned. We've really gotten a glimpse into the incredible work that these paramedics do in such high-pressure situations.
It really is amazing work that they do.
Yeah, it is. It really is amazing work. It makes you realize that childbirth, it's not always a walk in the park.
It definitely isn't always easy.
There's so much more to it.
Yeah, definitely more than meets the eye.
So let's pick up where we left off. We were talking about all those other things that paramedics are considering in those critical moments right after a baby is born.
Right.
It's not just about the 4Ts, right?
No, not at all.
What else is going through their minds?
Well, for starters, they're really focused on keeping the mom calm and reassured.
Okay, that makes sense.
They're explaining what's happening, what they're doing,
Yeah.
and why.
Okay.
Because, imagine
It's a scary situation.
it is. You're in a vulnerable position.
Yeah,
You've just given birth,
right.
and now there's this medical emergency.
So clear communication is key.
It's huge.
Yep.
And it's not just about the mom either.
Oh, right. What about the baby?
Exactly.
Yeah.
They need to make sure the baby is stable, too.
Oh.
Checking their breathing, their heart rate, making sure they're warm.
So they're basically multitasking like crazy.
They are. It's like a carefully choreographed dance
Wow.
with everyone working together to ensure the best possible outcome for both mom and baby.
It really does sound like a delicate balance,
It is a
Yeah.
very delicate balance. And on top of all of that, they're also thinking about what's next.
What do you mean?
Well, they're already planning for transport to the hospital,
Okay.
figuring out the best route, contacting the receiving facility to give them a heads up about the situation.
So they're kind of like air traffic control,
Yeah, exactly.
making sure everything runs smoothly.
They're coordinating all the moving pieces to ensure the mom gets the definitive care she needs as quickly and safely as possible.
Wow. It's amazing how much they're doing all at once.
It really is. It's a testament to their training, their skills, and their dedication.
This deep dive has been so insightful. It's really given me a whole new appreciation for what paramedics do.
I'm glad to hear that.
They are truly on the front lines of healthcare.
They are. They're the first point of contact for so many people in need.
Well, I think we've covered a lot of ground today.
We have.
And I'm sure our listeners are eager to hear your final thoughts.
Yeah.
What are some of the key takeaways you think everyone should walk away with about oxytocin and its role in emergency childbirth?
Well, I think the biggest takeaway is that oxytocin is a powerful tool.
Right.
It can be incredibly effective in managing postpartum hemorrhage,
Uh-huh.
but it's not a magic bullet,
Oh, okay.
and it's not without its risks.
That's important to remember.
It is.
Yeah.
Paramedics need to be aware of those risks,
Yeah.
and they need to be prepared to manage any potential complications.
So ongoing training and education are crucial, right?
Absolutely. They need to stay up to date on the latest guidelines,
Uh-huh.
the best practices,
Yeah.
and the latest research to ensure they're providing the highest quality care possible.
And this all highlights the importance of having well-trained and well-equipped paramedics available in every community, right?
Absolutely. Access to timely and effective emergency medical care can truly be the difference between life and death.
It's a powerful reminder that healthcare is a human right and that everyone deserves access to quality care regardless of where they live or their circumstances.
Couldn't agree more. It's something we should all be advocating for.
This deep dive has given us so much to think about,
Yeah, it has.
and it's a great reminder that there's always more to learn.
There always is.
So as we wrap up our discussion on oxytocin in emergency childbirth,
Uh-huh.
I want to leave our listeners with this thought. What are some of the ways we can support our local paramedics and first responders?
That's a great question.
How can we show our appreciation for the incredible work they do? It's something to ponder as we continue to learn about the complexities of healthcare and advocate for a system that prioritizes the well-being of everyone.
Well said. And on that note, I want to thank you for having me on the show today. It's been a pleasure diving into this topic with you.
The pleasure was all mine. Until next time, keep exploring, keep learning, and keep asking those important questions.
Yeah, it has been. Really makes you think.
It does. And it's incredible, just thinking about the level of skill and compassion that these paramedics bring to every situation,
Yeah.
or dealing with life and death,
Yeah.
and making these split-second decisions
Right.
that could have such a huge impact.
It's a lot of responsibility.
It is. So before we wrap up this deep dive, I'm curious to hear your final thoughts.
Okay.
What are some of the key takeaways you think our listeners should walk away with? about oxytocin and its role in emergency childbirth.
Well, I think the most important thing to remember is that oxytocin, it's a powerful tool.
Mm-hmm.
It can be really effective in managing postpartum hemorrhage,
Yeah,
but it's not, a cure-all,
right.
but without risks.
So it's not like a one-size-fits-all solution.
Yeah. No, not at all. Paramedics really need to understand those risks.
Yeah.
And they need to be prepared to deal with any complications that might come up.
So ongoing training is key here, right?
Absolutely. They need to stay up to date on all the latest guidelines, the best practices
Yeah.
and all the latest research
Right.
to make sure they're giving the best possible care.
And this really underscores how important it is to have these well-trained, well-equipped paramedics available everywhere.
Yes, absolutely.
In every community.
Access to timely and effective emergency care can literally be the difference between life and death.
It's a powerful thought, isn't it?
It is. It really highlights how healthcare is a basic human right,
Yeah.
and everyone deserves quality care, no matter where they live or their circumstances.
So well said. Well, this deep dive has given us a lot to think about,
It has.
and it's a good reminder to keep learning and exploring.
Definitely. There's always more to learn.
So as we wrap up our discussion today, I want to leave our listeners with one final thought.
Okay.
What are some ways that we can support our local paramedics and first responders? How can we show our appreciation for all the amazing work they do? It's something to think about as we continue to learn about healthcare and work towards a system that values everyone's well-being.
That's a great point to end on.
Yeah, absolutely. Well, thank you so much for joining me on this deep dive into the world of emergency childbirth.
It's been my pleasure.
Until next time, everyone, keep exploring, keep learning, and keep asking those important questions. All right, listeners, we're going to be diving into some pretty intense territory today. This one hits close to home for anyone in healthcare, especially if you're working out there on the front lines.
Yeah, definitely.
We're talking about two paramedics, Christopher Marsha and Stephen Snivey, who ended up facing criminal charges because of how they handled a patient back in 2017.
This case really brings up a lot of questions about, where do we draw the line between a medical error and criminal negligence? It's a tough one.
Yeah, it's heavy stuff. And get this, the patient was a gunshot victim, but the people who actually fired the weapon were acquitted. The paramedics, though, they were found guilty. How does that even happen?
Yeah, that's something else.
So our mission in this deep dive is to break down exactly what happened, see where things might have gone off track, and then, explore what it all means for healthcare professionals in general.
I think the ripple effects from this case, they've been felt throughout the healthcare community.
Yeah.
So yeah, it's a crucial conversation to have for sure.
Absolutely. Okay, so to set the stage, this all went down in December 2017 in Hamilton, Ontario. Our patient, we'll call him Yusuf, was 19 years old and was shot at 8:51 p.m.
That specific time actually becomes a big deal later on, so keep that in mind as we go through this.
Okay, good point. So 5 minutes after the shooting, the first call went out to the police. They were on scene at 8:58 p.m. The fire department got dispatched a few minutes later, and then finally at 9:03 p.m., our two paramedics, Marshall and Snivey, got the call.
Their ambulance call report shows they arrived on scene at 9:09 p.m., 6 minutes later, which, given everything that was going on, seems like a pretty reasonable response time.
Yeah, totally agree. No one is saying they were dragging their feet getting there. But here's where things get interesting. They had Yusuf on a stretcher and loaded into the ambulance by 9:15 p.m. They didn't record his vitals for another 10 minutes, and the ambulance didn't actually leave for St. Joseph's Hospital until 9:42 p.m.
So that's a total of 30 minutes on scene, and that's what the prosecution really focused on. They saw that time frame as a potential delay in care.
Right. Now remember, we're trying to see this through the eyes of the paramedics as they were experiencing it. No hindsight. No knowing what we know now.
Right. It's so important to avoid that hindsight bias when we analyze situations like this.
Yeah, absolutely. So picture it. It's a chaotic scene. There's tons of conflicting information swirling around. And Yusuf himself isn't exactly the most cooperative patient.
Well, what's really striking is that everyone on scene, including the police, seemed convinced that Yusuf had been hit with a BB gun.
Right. And that little detail is huge because it plays right into what's called anchoring bias, which is that, human tendency we all have to get fixated on the first piece of information we hear, even if later evidence totally contradicts it.
Yeah, and that cognitive bias played a big role in how Yusuf's condition was misdiagnosed. I mean, think about it. The paramedics see a relatively small wound, everyone's saying BB gun, and they're dealing with a patient who's agitated and not cooperating.
So it's easy to see how they could think, okay, this is a psychiatric emergency, especially when you consider that one of the paramedics had never even encountered a penetrating trauma before, and the other had only seen it once, and that was on a leg injury.
Exactly. They just didn't have the experience to, quickly assess the situation and recognize the severity of Yusuf's injury, even with the conflicting information.
Yeah, and sadly, that anchoring bias mixed with the chaos of the situation sent them down a path that turned out to be the wrong one.
It's a powerful reminder that even seasoned professionals can fall prey to these cognitive biases, especially when they're operating under extreme stress. You know.
For sure.
Now, to really get into what happened next, we need to talk about the actual charges the paramedics faced. They weren't charged with criminal negligence,
Okay.
but with failure to provide the necessaries of life.
Okay, that sounds serious, but what's the difference? Why that specific charge in this case?
So, failure to provide the necessaries of life, that charge, hinges on something called a marked departure from the expected standard of care. Meaning, the actions taken were so far outside the norm that serious harm or even death was a foreseeable consequence.
I see.
It's not just about making a mistake. It's about actions that show recklessness, disregard for the patient's well-being.
So it's about the degree of negligence.
Yeah.
Like, I guess speeding versus driving drunk through a school zone, both are bad, but one is way more reckless.
Exactly. Mistakes happen. But in this case, the judge had to figure out, did those mistakes cross the line into criminal behavior?
Right. And one thing the judge seemed to focus on was how the paramedics handled Yusuf when they lifted him into the ambulance. Like, it wasn't the smoothest move, but was it really that bad?
Well, it's hard to say for sure without seeing the video footage. But my guess is if that rough handling was caught on camera, it probably created a pretty powerful visual for the court. It might have contributed to, the overall impression that the paramedics were callous and dismissive of the patient's condition.
Oh, so like how things look can be just as damaging as the actual medical errors themselves?
It's like that saying, perception is reality.
Right.
And there's another legal aspect of this case that's really important to understand.
Okay, what's that?
The idea of joint and several liability.
Right. That's related to how the two paramedics were tried together. Right? So even though one was technically in charge and the other was assisting, they were both held responsible for what happened.
Precisely. The legal concept is when you work as a team, you're all responsible for each other's actions, which raises some big questions for healthcare professionals.
Yeah.
What happens if there's disagreement on how to handle a situation? How do you make sure there's clear communication? And maybe, most importantly, do you have the courage to speak up when something seems off, even if you're the most junior person on the team?
Wow. Yeah. It's about having each other's backs, but it's also about advocating for the patient, even if it means disagreeing with a senior colleague. That takes guts.
Absolutely. Now let's talk about the verdict itself and what it could mean moving forward. The paramedics were found guilty.
Right.
And sentencing is happening next week.
Right.
We don't know the exact outcome yet.
What are the possibilities? Like, what kind of consequences are we talking about? And what does this case mean for other healthcare providers? Is this like a precedent-setting decision?
Well, the range of sentence is pretty broad. It could be anything from a conditional discharge all the way up to a significant prison sentence.
Yeah.
I doubt they'll get the maximum.
Okay.
But the guilty verdict itself is a huge deal. It sends a message.
So it's not just going to be a slap on the wrist and a mandatory retraining course or something.
No, not at all. This case makes it clear that healthcare providers can be held criminally liable for errors in judgment, even if those errors don't directly lead to a patient's death. It's a wake-up call for the entire profession.
So for our listeners out there who are working on the front lines, what does this mean for them? Should they be, freaking out about every decision they make?
Panic is never helpful, but awareness is crucial. This case really emphasizes the importance of meticulous documentation, open communication, and a willingness to reevaluate initial assumptions, especially in tough situations.
So basically being incredibly thorough, being a good team player, and most importantly, being a true advocate for your patients.
Exactly. And remember that CIA mnemonic we talked about, capacity-informed action plan. When you're documenting a call, especially a complex one, think about it. Does the patient have the capacity to make decisions? Have you fully informed them? And what's your action plan based on everything you know at that moment? Documenting those elements can really help demonstrate that you are being careful and thoughtful.
So you're basically creating a clear record showing you considered everything you were thinking critically and acting in the patient's best interest. even if the outcome wasn't perfect.
Exactly. That kind of thorough documentation could end up being your best defense if you're ever in a similar situation.
Yeah, it really makes you think about how important communication is, especially when the stakes are so high.
Absolutely. You were talking about joint and several liability before. If you're part of a team, you share the responsibility. So, if you see a teammate doing something that seems questionable, or if you just have a different take on the situation, don't be afraid to speak up.
Right. It's better to have a quick discussion right then and there than to face, serious consequences later.
Exactly.
Yeah, it's about supporting each other, but always with the patient's well-being as the top priority.
Right. And that leads to another big takeaway from this case, the importance of constantly challenging our own assumptions.
You're talking about that anchoring bias again, right? How we can get so stuck on that initial piece of information, even if it turns out to be wrong.
Exactly. In this case, they were told it was a BB gun injury.
Right.
And they just seemed to latch onto that idea, even when other evidence, might have suggested something more serious.
So how do we avoid falling into that trap ourselves?
Well, it's about staying alert, being open to new information as it comes in, and being willing to reassess our initial assessment as the situation changes.
Don't believe everything you think, right?
Exactly.
Ugh.
We have to be critical thinkers, even when we're under pressure. And that brings me to my final piece of advice for everyone. Never stop learning.
Right. Medicine is always changing. New protocols are being developed. We have to stay ahead of the curve.
Absolutely. Go to conferences, read journals, learn from your peers, whatever it takes to keep your knowledge and skills sharp.
Yeah. At the end of the day, it's about giving our patients the best possible care while also protecting ourselves from unnecessary risks.
Well said. It's a delicate balance, but one we all need to strive for.
All right, listeners. That brings us to the end of our deep dive. It's been a heavy one, but I hope you got a lot out of it.
I hope it sparks some important conversations.
This goes way beyond just this one case.
Yeah.
It's about the future of healthcare and the quality of care we provide.
Exactly. So be safe out there, be smart, and keep learning.
And remember, you're not alone in this. We're all in this together.
All right, everybody, welcome back for another deep dive.
Yeah, looking forward to this one.
Today, we are diving into something pretty wild, coming out of Ontario, Canada.
Really interesting stuff.
The paramedics in Ontario are now authorized to perform patella reductions.
That's really pushing the boundaries.
I know, right? Paramedics popping kneecaps back into place.
Who would have thought?
We got our hands on some audio training material for the paramedics.
And let me tell you,
This stuff is way more interesting than it sounds.
it really is.
I guess to start off, for those of us who maybe aren't familiar, can you give us a quick breakdown of what exactly a patellar dislocation is?
Yeah, so the patella is your kneecap,
Right,
and it sits in this groove.
like a little track.
Yeah, exactly, at the end of your thigh bone.
Uh-huh.
But sometimes it can actually slip out of that groove,
Oh, wow.
and it usually slips to the outside of the knee.
Okay.
That's what we call a lateral patellar dislocation.
Ouch.
Yeah, it can be incredibly painful,
I bet.
and it often makes it impossible to walk.
So this reduction procedure,
Yeah,
this is basically like putting it back in place.
that's exactly what it is.
Okay.
But there are very specific rules
Of course.
about when paramedics can actually do this.
Right, so there are some criteria.
Yeah,
They can't just go around plopping kneecaps back in.
exactly. So the patient needs to be between 10 and 50 years old.
Okay.
They have to be fully alert,
Uh-huh.
and the injury cannot be from like a high-speed car crash
Makes sense.
or a direct hit to the knee.
Right.
So these criteria are all in place to help ensure that it's safe.
To do this in the field.
Exactly.
So let's say all those criteria are met.
Right.
A paramedic shows up on scene.
Yeah.
Patient's got a dislocated kneecap. What does the actual procedure look like?
So first they position the patient,
Okay.
either sitting or lying down.
Fair.
And then while gently extending the patient's knee, the paramedic carefully lifts the kneecap
Okay.
and applies pressure to that outer edge
Mm-hmm.
and guides it back into that groove.
It kind of makes me cringe just thinking about it.
It does sound kind of rough, doesn't it? But the key is gentle, controlled movements.
Right.
And of course, paramedics undergo rigorous training
Yeah, for sure.
before they can perform this procedure.
Of course. So let's say everything goes smoothly.
Right.
Patella's back in place.
Okay.
What happens next?
So even with the successful reduction, the patient still needs to be transported to the hospital
Okay.
for further assessment and treatment.
Makes sense.
They might need pain medication, imaging tests, or even surgery in some cases.
Yeah, so even though they're able to put it back in the field, they still need to go to the hospital.
Exactly.
Documentation is obviously really important in emergency medicine.
It's crucial.
Are there any key things that paramedics need to be documenting when they do this procedure?
Yeah, absolutely. So neurological status of the patient
Okay.
before and after the reduction,
Mm-hmm.
their pain levels,
Mm-hmm.
and any difficulties that were encountered.
During the procedure.
Exactly. This information all helps to ensure that the patient gets the best care possible.
At the hospital.
Exactly when they arrive.
So I understand this whole procedure. It's actually part of like a 2-year study.
That's right.
What is the point of this research? What are they hoping to find?
So the goal is to gather data on the effectiveness and safety of this procedure in a pre-hospital setting.
Okay.
They're looking at how well paramedics are performing the reduction, how patients are responding, and if there are any long-term complications.
So it's brand new. They're still trying to gather all this information.
It's very new.
Only 5 cases so far.
That's right, but it's still very early in the study.
Yeah.
But they're collecting tons of information from each case.
Like what kind of information?
So patient demographics, injury details,
Mhm.
success of the reduction,
Okay.
any follow-up care that was required.
Wow.
They even send out surveys to patients
Really?
to get their feedback on the whole experience.
That's interesting. They're really going to lengths to track all this.
Yeah, they are.
It shows how committed they are to properly evaluating this new procedure.
Absolutely. And, they're also providing a ton of resources for the paramedics.
Okay. Like what kind of resources?
Videos, PowerPoint presentations, online training modules.
Wow. So they're really putting a lot of effort into this,
They are.
making sure it's done right.
Exactly. It's great to see them investing in support and education.
So we've talked about what it is, how it's done, but why is this such a big deal?
Well, think about it. If paramedics can safely and effectively reduce these dislocations
Yeah.
out in the field, it could lead to much faster pain relief for patients.
Right on scene.
Exactly. And it could potentially reduce a strain on emergency rooms.
That's a big one.
Yeah, it's a potential win-win.
For the patients and the healthcare system.
Exactly.
That's pretty incredible.
It is.
So what do you think about this? I mean, could this open the door for paramedics to start taking on even more complex procedures?
That's a really great question.
It's definitely pushing the boundaries of pre-hospital care.
It really is. And as technology advances
Yeah.
and paramedics are receiving more specialized training,
Uh-huh.
we might see a shift toward these more advanced procedures.
Right. Being done outside of the hospital.
Exactly.
Yeah.
But it's really important to consider those risks and benefits
Of course.
and make sure that patient safety is always the top priority.
It's a really interesting conversation to be having.
It is.
And I'm sure we're going to see even more developments in this area in the years to come.
I think so too.
Well, this has been another fascinating deep dive.
Always a pleasure.
Thanks for joining us.
Thank you.
And we'll see you next time
See you then.
for another deep dive.
Looking forward to it.
All right. Take care, everybody.
Bye. 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 Welcome back, deep divers. Today we're going deep on CPAP, but not just for sleep apnea, which you probably already know about.
Right.
We're diving into its role in emergency medicine, really, pre-hospital care. You guys sent in some great research on this, so get ready for a rapid but thorough look at CPAP, how it works, its medical uses, and the potential impact it has before patients even get to the hospital.
And to really get that,
Yeah.
it's helpful to remember what's going on in the body when someone is in respiratory distress.
Yeah, let's set the scene anatomically speaking. What should we be picturing?
We'll think about the upper respiratory tract,
Hmm.
the nose, the pharynx, and the larynx.
Okay.
They're essential for breathing, of course, but
Mhm.
also for warming and humidifying, filtering the air.
Yeah.
And when someone's in respiratory distress, those airways, they can get compromised.
Gotcha. So it's not just about getting oxygen in, but also about maintaining those airways.
Exactly. And that's where CCAP can be so effective. It acts as a splint, basically, by providing positive pressure. It prevents those airways from collapsing.
Makes sense. Now, how do we even assess someone's breathing out in the field? What are the tools?
We rely on oxygen saturation monitoring, using those pulse oximeters you often see. But, and it's a big but, pulse oximetry has its limitations.
Oh, like what?
Well, simple things like nail polish can affect the readings.
Really?
Oh, yeah. Bright lights, too. And, of course, carbon monoxide poisoning, that can really throw things off.
So it really is about treating the patient, not the numbers on the monitor.
Couldn't have said it better myself.
Yeah.
Now, you might be familiar with the term PEEP, positive end expiratory pressure, which is often used for patients on ventilators.
Mm-hmm.
CPAP actually provides a similar benefit, but for patients who are breathing on their own.
Oh, I see the connection. It's all about maintaining that positive pressure to keep the airways open.
Exactly. And one of the huge advantages of CPAP is it can sometimes help avoid the need for intubation, which comes with its own risks.
Right. Intubation is a pretty serious intervention.
It is. Because one of the big risks with intubation is something called ventilator-acquired pneumonia, which carries a significant mortality rate 20 to 50%, and sometimes even as high as 70% in some cases.
Wow, that's a sobering statistic. It really underscores why alternatives like CPAP are so important. Now, I got to ask about the history of CPAP. It feels like a relatively new thing, but is that accurate?
Not really. The earliest documented use of positive pressure support actually goes all the way back to 1912.
Oh, wow.
Yeah, an anesthesiologist named Sterling Bonnell, he used a modified mask to help maintain lung expansion during thoracic surgery.
So the idea's been around for a while.
Definitely. And then in the 1930s, we see another cool development. Doctors Putton and Oxen, they designed something called a pulmonary plus pressure machine to treat pulmonary edema.
Okay, what did this early device look like?
Get this, it was a modified vacuum cleaner.
What?
Seriously. They combined a vacuum cleaner with an adjustable spring valve and warmed the air using a hot water bottle inside the dust bag compartment. Pretty ingenious, right?
That's amazing. From a modified vacuum cleaner to a life-saving medical device.
It's a testament to human ingenuity, for sure. And the innovation continued. In the 1980s, J.B. Dale invented a Venturi-based CPAP device, which was a big step towards the modern systems we use today.
So CPAP has a much richer history than I think most people realize. Okay, let's shift gears a bit and talk about how CPAP is being used in pre-hospital settings today. Your research highlights two primary applications: congestive heart failure, or CHF, and COPD.
You got it. In CHF, the heart can't pump efficiently, leading to fluid buildup in the lungs, making it incredibly difficult to breathe. CPAP helps by, as we said earlier, splinting those airways open and improving oxygenation.
So it's like giving those overworked lungs some much-needed breathing room. What about in COPD?
COPD, which often stems from smoking, involves damage to the airways leading to airflow obstruction. CPAP helps by counteracting that obstruction and improving gas exchange.
So it's a pretty versatile tool for different types of respiratory emergencies, but do we have evidence that CPAP actually works in these situations?
Oh, absolutely. There's compelling data from patient charts.
Oh, good.
In one study, 68% of patients receiving CPAP showed general improvement, as documented by paramedics. And when you combine CPAP with other treatments, the numbers get even better. For instance, with nitroglycerin for CHF patients, the improvement rate jumped to 78%. And for COPD patients, when combined with salbutamol, 70% saw improvement.
Wow, those are some impressive numbers. That really shows CPAP's effectiveness. And beyond improving breathing and maybe helping avoid intubation, are there any other advantages to using CPAP?
Definitely. One big one is patient comfort. CPAP can actually reduce the work of breathing, which in turn can alleviate the anxiety and fear that often come with respiratory distress.
So it's not just the physiological benefits, but the psychological impact as well.
Absolutely. And by improving breathing, CPAP can also help preserve speech and swallowing, which allows patients to communicate with loved ones and, of course, healthcare providers.
Oh, that's huge, especially in a medical emergency. Now, we've been talking about CPAP, but I know there's also BiPAP. How does that differ?
BiPAP stands for bilevel positive airway pressure. It delivers two distinct pressures, one for inhalation and a lower one for exhalation. This could be really helpful for patients who struggle to exhale against that constant pressure of CPAP.
So it's like a more customized approach.
Exactly. But while BiPAP might be preferred in a hospital setting, CPAP is generally more practical for pre-hospital care. It's simpler to use, requires less adjustment, and still provides those important benefits.
Okay, so it's like the reliable workhorse for respiratory support in the field. Now let's talk about some practical considerations for actually using CPAP pre-hospital.
Sure. One thing to remember is that not every patient is going to love having a mask strapped to their face. Some might experience anxiety, claustrophobia, or just general intolerance.
That makes sense. How can first responders best address those concerns?
Communication is key, really. Reassuring the patient, explaining what's happening, and gradually applying the mask, maybe letting them hold it first, all that can help.
So, building trust and making the patient as comfortable as possible. What about adjusting the CPAP pressure itself? How does that work?
That process is called titration, and it's a vital part of CPAP therapy. It's basically adjusting the pressure to achieve the best effect for that particular patient. We're looking for improvements in breathing a decreased respiratory rate, reduced effort, and improved oxygen saturation.
Got it. So it requires careful observation and adjustment. And just to be clear, CPAP is just one part of the overall treatment plan, right?
Absolutely. It's an adjunct therapy that should always be used alongside other appropriate medications, like nitroglycerin for CHF and salbutamol for COPD, as we mentioned earlier.
Right, a multifaceted approach. Okay, before we wrap up the section on pre-hospital care, let's touch on safety. Are there any key things to remember?
Absolutely. One crucial thing to remember, and Health Canada has actually put out a reminder on this, is that CPAP is not a ventilator. It cannot provide life support if a patient goes into full respiratory failure.
So it's not a replacement for more advanced airway management if the situation gets worse.
Precisely. If the patient's condition deteriorates despite the CPAP, we've got to switch to bag valve mask ventilation.
Safety first,
Yeah.
always. So where do we go from here? What's next for CPAP in pre-hospital care? Is it here to stay?
From what we're seeing, I think CPAP is poised to play an even bigger role in emergency medicine moving forward. It's a powerful tool with, I think, a lot of potential to change how we care for patients with respiratory distress, especially in those critical moments before they reach the hospital.
Yeah, it really does seem like CPAP is changing things. We've talked about the practical applications, but I'm really curious about the physiology behind it all. You mentioned earlier that CPAP increases FRC, which stands for functional residual capacity, right?
Right.
Can you break that down for us? Like, what is that and why is it important?
Sure. Think of FRC as your lungs' emergency reserve of oxygen. It's that air that stays in your lungs even after you exhale normally. And CPAP helps increase that reserve. So you have, more breathing room, so to speak, when you're struggling to breathe.
Makes sense. So it's boosting that reserve capacity. Are there other ways it's actually impacting the lungs?
It also improves what we call lung compliance.
Huh.
Imagine trying to inflate a stiff balloon. It takes more effort than a flexible one. Well, CPAP helps make the lungs more pliable, I guess you could say. Easier to inflate, which means easier breathing.
So it's reducing the effort it takes to breathe. That must be a huge relief for someone in respiratory distress.
It is. And by increasing that FRC and improving lung compliance, and of course keeping those airways open, CPAP helps oxygen move from the lungs to the bloodstream more efficiently.
So it's all about optimizing that gas exchange. This is taking me back to my EMT days. Remember learning about Dalton's law of partial pressures?
Of course.
Does that come into play here with CPAP?
It does. Dalton's law basically tells us that even a small increase in airway pressure, which is what CPAP is providing, can increase the partial pressure of oxygen in the lungs. And that means more oxygen is available to move into the bloodstream.
So even a small change in pressure makes a big difference in oxygen uptake.
Exactly. It might seem subtle, but for someone struggling to breathe, that extra bit of oxygen can be, life-saving.
Now, thinking about the future of pre-hospital care, where else might we see CPAP being used? I mean, we talked about CHF and COPD, but are there other applications on the horizon?
There is growing interest in using it for things like acute respiratory distress syndrome, or ARDS, and even severe asthma attacks. Research is still ongoing, but the early results are looking promising.
So potentially expanding its reach beyond those conditions we typically associate with CPAP. Are there any technological advancements we can expect to see that might further enhance CPAP's role in pre-hospital care?
Definitely. We're seeing some really cool innovations in mask design aimed at improving comfort and making them easier to tolerate, which is huge. And of course, the devices themselves are getting lighter, more compact, easier to use out in the field.
Yeah, portability is key. So it sounds like CPAP technology is constantly evolving. What's your overall prediction for the future of CPAP?
I think it's going to become a standard tool for every first responder. As the technology improves and we get more and more evidence of its effectiveness, I think it'll just continue to play a bigger and bigger role in, saving lives, really.
It's pretty incredible to see this evolution in care happening right before our eyes. So let's take a minute to recap what we've learned in this deep dive into the world of CPAP.
Yeah, we've covered a lot. We started with the anatomy, the respiratory system, then went all the way back to the beginning, back when CPAP was just a modified vacuum cleaner.
Who knew, right? And now it's these sophisticated devices we're talking about. We learned that CPAP isn't just for sleep apnea anymore. It's a valuable tool for managing all sorts of respiratory distress, particularly in conditions like CHF and COPD. And we got into the science behind it, how it impacts lung function, and ultimately how it helps improve oxygenation.
We talked about the importance of titration, which is that process of adjusting the pressure to get the best response for each patient. And we emphasize that CPAP is just one part of the treatment plan, right? It's meant to be used along with other appropriate medications.
Right, a team effort. And of course, we can't forget the potential for CPAP to, revolutionize pre-hospital care, reduce the need for intubation, improve comfort for patients, and lead to better outcomes overall. It really is a game changer.
It is. CPAP is a great example of how medical innovations can truly improve patient care. And as we continue to explore its potential, I have no doubt that we'll see even more amazing benefits in the future.
I agree. Well said. Now, before we leave you with a final thought to ponder, I just want to thank you all for joining us on this deep dive into the world of CPAP. We hope you've gained some valuable insights and maybe a newfound appreciation for this incredible technology.
Absolutely. And we encourage you to keep learning, keep exploring this topic. There's so much information out there for anyone who wants to dig deeper into the science, the technology, the future of CPAP.
So as we wrap up this deep dive, I want to leave you with something to think about. We've talked about how CPAP can change pre-hospital care, but how could that impact the whole healthcare system, really?
Well, that's a really interesting question. Just imagine if paramedics and EMTs could provide this level of respiratory support right there, at the scene. It could mean faster treatment, maybe fewer hospital admissions, and in the end, better outcomes for patients who are struggling to breathe.
It's a future with massive implications, not just for the patients, but for the whole system. So as we wrap up our exploration of CPAP, we encourage you to, keep learning, stay curious about this ever-evolving world of medical innovation.
Remember, knowledge is power. The more you understand about things like CPAP, the better you'll be able to advocate for yourself, for your loved ones.
Absolutely. Until next time, happy deep diving. Hey listener, welcome back. Today we're going to be taking a deep dive into the ZOL rapid shock algorithm.
Okay.
Imagine yourself, you're a paramedic, you show up on scene, every second is critical in a cardiac arrest. And this is a piece of technology that can really help you make faster decisions about defibrillation.
And potentially life-saving decisions.
Exactly.
Yeah. It's not just about the speed, though. What's really fascinating about this is that it analyzes the patient's ECG right during CPR to determine whether a shock is actually even needed.
Oh, wow.
Yeah, and this thing has really been put through its paces. Over 300 cases have been analyzed. 2 years of research have gone into this.
Mm-hmm.
And they're already using this in patients 8 years and older.
That's amazing. So let's break it down a little bit. How does this work? Like when you're in the field,
Sure.
you arrive on scene, you apply the pads, and you hit analyze, but that initial analysis isn't the rapid shock yet.
Correct. Yeah, you need more data for it to make the best decision possible.
Okay.
So it's going to observe the ECG for a full 2 minutes while CPR is ongoing.
Wow.
So it's really getting, all the clues it can. And then if it detects a shockable rhythm, then the defibrillator pre-charges, automatically saving you those crucial seconds.
Oh, wow. So it's not just working faster, but it's working smarter.
Mm.
So for our paramedics out there listening, what are some of the must-know takeaways from all the research you've done on this?
Sure. Well, minimizing chassis time, as they call it, is absolutely crucial. So that's any time that you're not doing compressions.
Right.
So some things that you can do to help is, pre-connect your defib leads even before you get to the patient. And, have somebody designated to just do airway and ventilation.
Yeah.
That way there's no switching back and forth.
That makes a lot of sense. So you're minimizing those transitions. What about when it's time to transport?
Yeah, good point. You need to exit out of rapid shock mode when you're transporting, or if the patient rearrests en route.
Interesting.
And this is just to make sure that you're in control and that it's not analyzing, data that could be misleading because of the movement.
Gotcha. So it's about staying adaptable to the situation as it evolves. What else should paramedics keep in mind?
Well, one thing is the defibrillator is going to default to 200 joules.
Okay.
And that's effective for a lot of patients, but, obviously be ready to adjust if, based on the history of that patient.
Right.
And then, another thing is switching compressors every 2 minutes helps avoid fatigue.
Yeah.
And, that way those compressions are good quality compressions.
Okay. So far, so good. But what if the algorithm just, doesn't work the way you expected it to?
Yeah, so that's when your training takes over.
Right.
So you want to switch to manual mode right away, initiate CPR, and then really clearly document the reason for the switch. Technology is great.
Yeah.
But it's a tool.
Yeah.
And you're the one guiding it.
You're the expert in the room. Now, speaking of documentation, it seems like that is a recurring theme in all this research. Why is that so important?
It really is. It's incredibly important to document. So noting things like the rhythm that you see on the monitor,
Hmm.
The analysis results from the algorithm, and then, like we said, any unusual circumstances.
Mm-hmm.
If you have to exit out of rapid shock mode, what was the reason for that? It creates a very transparent record of what happened.
Okay, so now that we sort of covered those basics, let's get into some of the, deeper, more nuanced aspects of this technology. I know you've done a deep dive into this research. What are some of the more fascinating elements of this?
One fascinating factor that can really affect the algorithm is this thing called thoracic impedance.
Okay.
And it's basically just the electrical resistance of the chest.
Mm-hmm.
And what's interesting is that it changes. It changes with breathing, CPR compressions, even slight patient movement.
Oh, wow.
It can affect it.
So it's like the algorithm is trying to read a signal that's constantly shifting.
Yes,
Yeah.
exactly. It can be a little tricky.
I can imagine that would be tricky. Can you give us an example?
Sure. Well, as the chest expands during breathing, for example, the distance between the electrodes increases, right?
Right.
So that impacts the electrical resistance.
Oh, wow.
The same happens with compression. So it's a very dynamic environment.
That is so wild to think about. So, it makes you realize, even though the rapid shock is designed to sort of filter out that noise, it makes you realize how important it is to minimize any of those external factors during that analysis phase.
Exactly. And, all the research points to no touching the patient during analysis.
Hands off. Why is that so crucial?
Yeah. Well, there was one case that they presented where CPR was continued during analysis,
Yeah.
and it led to the algorithm misinterpreting the rhythm.
Oh, wow.
So the takeaway is absolute stillness during that time.
Otherwise, it's like trying to hear a whisper in a hurricane.
Exactly. Even the slightest interference can really have significant consequences.
So that's a big one for our paramedics to remember. Just let the algorithm do its thing, no distractions. But, we've also learned that there are times when, despite this amazing technology, that things might not go exactly as planned. So what happens then?
Well, if you do run into any kind of malfunction, it's really crucial to report that. Ideally, retain the pads for analysis if you can.
Okay.
And this feedback is really valuable. It helps identify potential issues and contributes to that ongoing research and development.
So continuous improvement. Now let's talk about how all of this comes together, in practice. What does it actually look like for a paramedic using this technology in a real cardiac arrest situation?
Well, they need to be ready to act quickly because, every second counts.
Mhm.
And the algorithm is designed to help speed things up.
Right.
You need to be prepared to deliver that shock immediately when it advises you to do so.
Yeah.
Or, resuming compressions just as quickly if it advises against it.
So it's about being in sync with the technology.
It really is.
Yeah.
And being informed. So stay up to date on the latest research, any new guidelines. This technology is constantly evolving. Your knowledge needs to evolve right along with it to provide the best possible care.
That's such a good point. It's not a set it and forget it kind of tool. So let's talk about those situations that don't fit the textbook definition, the unusual circumstances. What are some of the things that paramedics should be prepared for when those curveballs inevitably come up?
Yeah. I mean, there will be times when, you encounter challenges that require you to think outside the box a little bit. Maybe the patient is in a difficult location or there are other factors complicating things.
Right. Those are the moments that really test a paramedic's skills.
They do. And
Yeah.
being adaptable and knowing, when to deviate from that standard protocol. So, for instance, if the algorithm doesn't give you a clear recommendation after that initial analysis, it might be prudent to just exit out of rapid shock mode and just go ahead and proceed with your regular cardiac arrest protocol.
Oh.
But, as we've discussed, document your rationale.
Yes, super important. Now, speaking of adapting to different scenarios, let's talk about transport. So the patient is stable. It's time to get them to the hospital. What should paramedics keep in mind when they're transporting someone who's been treated using the rapid shock algorithm?
Well, first and foremost, always exit out of the rapid shock mode before you start moving the patient. It might seem obvious, but in the heat of the moment, it can be easy to overlook.
Right, it's good to have those reminders. So why is exiting the mode so important during transport?
Well, even those slight movements during transport can create those artifacts that might mislead the algorithm if it's still analyzing.
Right.
So it's about maintaining control, making sure the technology is working with you, not against you.
So knowing when to trust the tech and when to, take the reins yourself. What about ROSC? We always have to be thinking about ROSC.
Absolutely.
So return of spontaneous circulation. Even if they were successfully resuscitated at the scene, they could rearrest during transport. You got to be ready for that.
Yes. You need to be ready. Being prepared for ROSC during transport is key.
Okay. So let's say ROSC happens during transport. What are the steps that a paramedic needs to take?
Okay, so first things first, you want to stop the ambulance right away,
Mhm.
reassess the patient, and then decide how you're going to proceed. If they're stable, then you can continue transport, obviously monitoring them closely.
Right.
But if they deteriorate or rearrest, then you're going to reinitiate that rapid shock algorithm and follow the appropriate protocol.
Wow, that's a lot to handle. It's really amazing how paramedics stay so calm and collected in those situations.
Yeah, it's a testament to their training and dedication.
Yeah.
They really are on the front lines,
Yeah.
and this is a really powerful tool that they have at their disposal.
Speaking of tools, let's talk about the algorithm's default settings for a moment. It defaults to 200 joules we've talked about, but why is that the default?
Yeah, well, that's because it provides a good balance of effectiveness and safety
Okay.
for most patients. But of course, there will be times where you need to adjust that based on the individual's condition or, maybe they have a history of previous defib attempts.
So it's like having a safety net, but also knowing when you need to customize the approach.
Exactly. It's a powerful tool, but it's important to remember it is just that, a tool. Your knowledge, skills, and experience are what's really guiding its use.
And speaking of knowledge and skills, we can't forget about the importance of ongoing training,
Oh,
right?
absolutely. Medical technology is constantly evolving,
Right.
and so is this algorithm. So, new research, updates to the algorithm, new best practices, all necessitate continuous learning.
It's like learning a language. You have to keep practicing and expanding your vocabulary to stay fluent.
Exactly. Ongoing training keeps paramedics up to date and, ensures they're not just proficient, but also aware of those latest nuances.
Right. So it's mastering the fundamentals, but also embracing that mindset of continuous improvement.
Exactly. And this improvement is driven by feedback and data analysis.
Now, I know data analysis may not sound as exciting as racing against time to save lives,
True.
but it plays such a crucial role.
It does. Every time this is used, it generates valuable data that can be analyzed.
Yeah.
Identify trends, assess its effectiveness, pinpoint areas for improvement. Think of it as a feedback loop, refining that technology over time.
So it's a constant process of tweaking and refining based on the data we gather.
Exactly. And EMS organizations play a big role in that,
Yeah.
They need to collect data on each use of the algorithm. They can share that data with researchers and developers, and that ultimately leads to a more accurate, efficient, and effective algorithm.
So it's a collaborative effort, everyone contributing to improving patient care. Now let's shift gears for a moment and talk about something that's really crucial for paramedics to understand: the limitations of the rapid shock algorithm. Because like any technology, it does have its limitations, rightly.
Right. Every technology has limitations,
Mm.
and this is no exception.
So what are some of the potential shortcomings that paramedics need to be aware of?
Well, its accuracy can be affected by, patient movement,
Uh,
electrical interference,
Mm.
even just the placement of the pads. So you need to use your judgment and your training to interpret its recommendations,
hmm.
make informed decisions based on that situation.
So it's a reminder that it's not a magic bullet.
Exactly.
Right. You need to use your judgment, your expertise. It's like having a co-pilot that gives you great guidance, but ultimately you're the pilot and you're the one who has to navigate the flight.
Yeah, that's a perfect analogy. And understanding those limitations is essential for using it effectively and safely.
Which ultimately leads to better care for our patients.
Exactly.
And that brings us to, I think, another really important aspect of all of this, which is the human element.
The human element.
Yeah. Sometimes we can get so caught up in the technical aspects we forget that we're dealing with real people in real lives. And for paramedics, who are often in those incredibly emotionally charged situations, they see tragedy, they see heartbreak, they see resilience. Using technology like this, I think, adds another layer of, emotional complexity to their work.
Right. On one hand, it can be very empowering for them. It's a tool that can potentially save lives, improve outcomes.
Like having a guardian angel, offering that extra support.
Yeah. But on the other hand, it can also be stressful. What happens when the algorithm, makes a recommendation that doesn't sit right with your gut instinct? Or when a patient doesn't respond the way you expected them to?
Right. That must weigh heavily on a paramedic's mind.
Yeah. So having a good support system is crucial.
Mhm.
Talk to colleagues, debrief after difficult calls, seek professional help when needed. And remember, you're not alone. Many paramedics experience these same challenges.
And what about the emotional impact on the patients themselves and their families? Imagine being in cardiac arrest and you know that a machine is playing a role in determining your fate.
That's a powerful point.
Yeah.
Paramedics need to be sensitive to those emotions, communicating, clearly and compassionately, and, explaining what's happening. Technology can enhance our ability to care, but it can never replace that human touch.
That is so well said. Technology as a complement to compassion, not a substitute for it.
Yes.
So before we wrap up this part of our deep dive, is there a final thought or question you'd like to leave our listener with?
Well, we've talked a lot about the present state of, the rapid shock algorithm.
Yeah.
But what about the future?
Oh, I like where this is going. Hit me with it.
As technology continues to advance, what role will algorithms like this play in the future of emergency medicine? Will they become even more sophisticated?
Yeah.
Capable of, making more complex decisions?
Will they eventually replace human paramedics altogether?
Or will they evolve into those collaborative tools that really enhance the skills and judgment of human providers? These are fascinating questions to think about as we navigate this ever-changing landscape.
And I am so looking forward to exploring those questions with you in part 2 of this deep dive.
Me too. We'll delve into those and more next time.
Welcome back, listener. We're picking up right where we left off, exploring the ZUL rapid shock algorithm. Really fascinating technology. But I'm curious to dig into, some of the finer points, the things that really make a difference out there in the field.
Well, one of those is this concept of thoracic impedance. We touched on it a little bit in the last part, but it's worth revisiting because it, directly affects how the algorithm interprets those ECG signals.
Okay, yeah, that's ringing a bell. But, for our listener who might not recall the specifics, could you give us like a quick refresher on, what exactly thoracic impedance is and why it matters so much in this context?
Sure. So thoracic impedance is basically the electrical resistance of the chest. And it's influenced by a number of things. Things like the patient's body composition, where you place the pads, even their breathing cycle.
So it's not a fixed value, it's constantly changing.
Right.
It's almost like the algorithm is trying to read a signal through a moving target.
Yeah, that's a great way to put it. And here's where it gets really interesting. During CPR, those compressions on the chest actually cause fluctuations in that thoracic impedance. And those fluctuations can create artifacts in the ECG signal, which can sometimes mislead the algorithm.
Oh, wow. So it's like trying to hear a faint radio signal, with someone constantly tapping on the antenna.
Exactly.
That must make the algorithm's job pretty tough.
It does. And while the rapid shock algorithm is designed to filter out these artifacts, it's not infallible. There are cases where those impedance fluctuations are so significant that they interfere with the algorithm's ability to accurately analyze the heart rhythm.
And that's where the paramedic's expertise comes in, right?
Exactly.
Knowing about these potential pitfalls and being ready to step in if needed.
Exactly. It really reinforces the importance of understanding that, even the most advanced technology has its limits. You have to stay vigilant, monitor the situation closely, and be prepared to switch to manual mode if you have any doubts about the algorithm's interpretation.
It's about striking that balance between trusting the technology and trusting your own instincts. Speaking of trusting, another theme we've talked about is documentation. You've mentioned how crucial it is for, a number of reasons.
It really is. Documentation creates a clear record of everything that happened, and that's important for quality improvement, research, even legal matters down the line. It's not just about ticking boxes, it's about painting a comprehensive picture of the patient's care.
So it's like leaving a trail of breadcrumbs, making sure everyone understands the path you took. What are some specific details that are especially important to document when you're using the rapid shock algorithm?
Well, you want to document the time you initiated the algorithm, the rhythm analysis results, any actions you took based on the algorithm's recommendations, and then your reasoning if you had to deviate from the standard protocol at any point.
Okay.
All of that just helps to create a very clear narrative of events.
It's like putting together a puzzle. Each piece of documentation helps to complete the picture.
Exactly.
And as you mentioned, good documentation can also help to protect paramedics, if there are ever any questions or concerns about their actions.
It's a safeguard for everyone involved.
Yeah.
Now let's shift gears a little bit and talk about something we touched on earlier, those situations that don't fit the textbook definition. The unusual circumstances.
Yes. The curveballs that life throws our way. The real world rarely follows a script, right?
Absolutely. There will always be times when you encounter challenges that demand, quick thinking and adaptability. And when it comes to the rapid shock algorithm, these unusual circumstances might include things like, patient movement during analysis, equipment malfunctions, even environmental factors that can affect the algorithm's performance.
Oh, wow.
It happens.
It sounds like paramedics need to be part detective, part problem solver, and always ready for the unexpected.
They do.
Ew.
And that's where training and experience really come into play. You need to be able to assess the situation, identify potential problems, find solutions on the fly.
It's like being a medical MacGyver.
Exactly.
So what are some examples of, situations where a paramedic might need to deviate from that standard protocol when they're using the Rapid Shark algorithm?
Okay, well, one example might be if the patient is moving around a lot during the analysis phase.
Okay.
Even small movements can create enough interference to, make the algorithm's reading unreliable. So in those cases, you might have to make a judgment call based on, your assessment of the patient and the situation.
So it's not just about blindly following the algorithm, it's about using it as a tool in conjunction with your own expertise.
Exactly. Another scenario might be, if you're dealing with a patient who has a history of certain cardiac conditions,
Okay.
you might need to adjust the settings or consider other factors that the algorithm isn't programmed to account for.
It sounds like it's all about understanding the nuances of the technology and knowing when to trust your gut.
That's a great way to put it. It's a partnership between technology and human intuition.
Now, I'm always curious to hear about, real-world examples of how this technology is being used in the field. It just helps bring everything to life. Do we have any, compelling case studies from the research we've looked at?
We do. One that really stood out to me involved a patient who was found unresponsive and in cardiac arrest. Pretty standard.
Yeah, classic cardiac arrest situation.
Exactly. The paramedics arrived, assessed the patient, applied the pads, initiated the rapid shock algorithm. The initial analysis indicated a shockable rhythm. But during the 2 minutes of CPR that followed, the patient moved slightly.
Uh-oh. That's a red flag we talked about earlier.
You got it. And in this case, that movement was enough to make the algorithm's final analysis inconclusive.
Oh, wow.
So the paramedics, recognizing that something wasn't quite right, decided to switch to manual mode and proceed with their standard cardiac arrest protocol.
That was a smart move. It really shows how important it is to be aware of the algorithm's limitations and to be ready to take control when needed.
Absolutely. And the good news is the patient was successfully resuscitated and transported to the hospital and made a full recovery.
Oh, that's fantastic. A real testament to the skill and quick thinking of those paramedics.
It really is.
So what are some of the key takeaways from this case study, that you think are important for our listeners to really grasp?
Well, first and foremost, it reinforces the importance of minimizing patient movement during analysis. Even slight movements can create enough interference to throw off the algorithm.
So stay still is the mantra during that critical analysis phase.
Exactly. Secondly, it highlights the need for vigilance. Even when you're using a tool as advanced as this one, you can't just, sit back and let it do all the work.
Right.
You need to constantly monitor the situation, watch for those red flags, and be ready to step in if needed.
It's about staying engaged, using the technology as a partner, not a crutch.
Right. And then finally, this case study really underscores the importance of clear and concise documentation. A well-documented case like this can provide valuable insights and help guide future practice.
It's like leaving a roadmap for other paramedics to follow so they can learn from your experience.
Exactly.
Okay, so we've covered the technical side, the importance of vigilance and adaptability, the value of good documentation. But I'm also curious about, the less tangible aspects of using this technology, the emotional impact.
Right. It's easy to get caught up in all the technical details, but, we have to remember that at the end of the day, we're dealing with real people's lives.
And for paramedics who are often facing, those life or death situations, that emotional burden must be immense.
It is. They see a lot of tragedy, a lot of heartbreak, but they also witness incredible moments of courage and resilience. And using technology like this adds another layer of complexity to their work, both positive and negative.
How so?
Well, on the one hand, it can be very empowering. It gives them access to these advanced tools that can potentially save lives and improve outcomes.
It's like having a technological guardian angel by their side.
Exactly. But on the other hand, it can also be stressful. What happens when the algorithm makes a recommendation that goes against their gut instinct? Or when a patient doesn't respond the way they expected them to, despite the algorithm's analysis?
Right. That must be incredibly difficult to grapple with.
It is. And it's important for them to have a strong support system in place. Talking to colleagues, debriefing after difficult calls, seeking professional help when needed. These are all essential for maintaining emotional well-being. And, it's important to remember that they're not alone. Many paramedics experience these same challenges.
And what about the impact on the patients themselves? Imagine being in cardiac arrest and knowing that a machine is playing a role in determining your fate.
That's a really powerful point. Paramedics need to be sensitive to the emotions of their patients and their families. It's important to communicate clearly and compassionately, explaining what's happening, why it's happening. Technology can enhance our ability to care, but it can never replace that human touch.
That's a beautiful way to put it. Technology as a complement to compassion, not a substitute for it.
Exactly.
So before we wrap up this part of our deep dive, is there a final thought or question you'd like to leave our listener with?
Well, we've talked a lot about the present state of the rapid shock algorithm, but what about the future?
Okay, so let's put on our futurist hats for a moment. What are some potential avenues of advancement that you see on the horizon?
Well, I think we're going to see algorithms become even more sophisticated,
Yeah.
capable of, integrating data from a wider range of sources, perhaps even predicting potential complications before they arise. But the big question is, how will these advancements impact the role of the paramedic?
Will these algorithms eventually replace human paramedics altogether?
That's the million-dollar question, isn't it? I think it's more likely that we'll see a shift toward a more collaborative model where technology augments human expertise rather than replacing it.
So a partnership where each brings their unique strengths to the table.
Exactly. The paramedics of the future will need to be as comfortable with data and algorithms as they are with stethoscopes and defibrillators. It's an exciting time to be in the field of emergency medicine.
It certainly is. I'm eager to continue this conversation and explore these possibilities further in the next part of our deep dive.
Me too. We'll delve deeper into the future of the rapid shock algorithm and its impact on paramedics and patients alike. Stay tuned.
Welcome back, listener. We're in the final part now of our deep dive into the Zizou rapid shock algorithm. And, we've really explored the ins and outs of this technology, how it's being used, even some of the challenges it presents. But now I want to kind of step into the future a little bit, put on our futurist hats, and imagine what's next. What's next for this game changer?
I think the future of emergency medicine is a very exciting one, and this is right at the forefront of that.
Yeah.
We're really on the verge of a technological revolution that's going to redefine how we deliver care.
Okay, paint me a picture. What kind of advancements are we talking about here? Give me the specifics.
Well, imagine a world where algorithms like this one don't just analyze ECG rhythms, but they integrate data from, a whole range of sources. Things like patient history, real-time vital signs, even environmental factors.
Oh, wow.
We'd be able to provide paramedics with a much, richer, more detailed understanding of the situation at hand.
So it's like having a super-powered assistant, right there in your pocket, analyzing all this information and giving you insights that would be impossible for a human to process on the fly.
Exactly. And think about the possibilities.
Yeah.
I mean, we could identify, subtle patterns, predict potential complications before they even arise.
Yeah.
And create personalized treatment plans with incredible precision.
So we're talking about a whole new level of personalized care.
Exactly.
But with all of this automation, some people might wonder, are paramedics even going to be needed in the future?
Yeah, that's a question that comes up a lot, but I don't think it's an either situation.
Yeah.
The future isn't about replacing humans with machines. It's about creating, a really powerful synergy between the two.
So more of a collaboration.
Exactly.
Where the technology enhances and supports the paramedic skills.
Precisely. Imagine, algorithms handling those data-heavy tasks, freeing up the paramedics to focus on what they do best, providing compassionate care, making those critical decisions in complex situations, and really connecting with patients on a human level.
It's like having a co-pilot who's a whiz at navigation but still relies on the pilot's expertise to fly the plane.
I love that analogy. That's a great one. The future of emergency medicine is about finding that sweet spot where technology and human expertise complement each other. And as algorithms become more sophisticated, we need to adapt our training programs and our protocols, make sure that paramedics are equipped to use these effectively.
So it's not just about adopting the new technology, it's about integrating it seamlessly into, our approach to patient care. Now, one technology that's creating a lot of buzz lately is artificial intelligence. It's already changing so many aspects of our lives, and now it's making its way into healthcare as well.
Absolutely. Artificial intelligence, or AI, has the potential to revolutionize how we approach emergency medicine. These algorithms can analyze massive amounts of data, spotting those subtle patterns that might be missed by the human eye. And in a field where every second counts, that kind of analysis can be incredibly valuable.
I can see how that would be a total game changer, especially in those high pressure situations, where decisions need to be made so quickly. What are some examples of that?
Sure. Well, think about an AI algorithm that could predict the likelihood of a patient going into cardiac arrest based on their vital signs, medical history,
Mhm.
even things like their location and the time of day.
It sounds almost like science fiction. I mean, are we really at the point where that's
We're
possible?
getting closer every day.
Yeah.
And these predictive algorithms could allow paramedics to identify those high-risk patients and intervene proactively, potentially preventing those life-threatening emergencies before they even happen.
That's incredible. It's like having a crystal ball that can foresee medical emergencies. But with such powerful technology, it comes with responsibility. We need to use it wisely. So, what are some of the challenges that we need to consider as we're integrating AI into emergency medicine?
Well, one of the biggest concerns is the potential for bias in these algorithms.
Yeah.
They're trained on these large data sets. And if those data sets reflect existing biases in our healthcare system, then the algorithms will perpetuate those biases.
So, for example, if an algorithm is primarily trained on data from, one demographic group, it might not be as accurate or effective when applied to patients from other groups.
Exactly. We need to be very intentional about ensuring that the data used to train these algorithms is diverse and representative of the entire population.
It's not just about creating smart algorithms, it's about creating fair and equitable ones.
Absolutely. Another important consideration is transparency. As AI algorithms become more complex, it can be really difficult to understand how they're arriving at their decisions.
So it's kind of like a black box. Data goes in, decisions come out, but we don't always know what's happening in between.
Yeah,
Eh.
good way to put it. And we need to find ways to make these algorithms more transparent so that we can understand their decision-making process and ensure that it aligns with our ethical values.
So it's about building trust in the technology and ensuring that it's being used responsibly.
Right. And finally, we need to think about, the impact of AI on the role of the paramedic.
Right.
As these algorithms become more capable, we need to make sure that paramedics don't become overly reliant on them.
Okay.
We don't want them to lose their critical thinking skills or their ability to make independent judgments.
It's like anything else. If you don't use it, you lose it.
Exactly.
So we need to find that balance between, leveraging the power of AI and maintaining those essential skills and judgment that paramedics bring to the table.
Exactly. The key is to train paramedics to be critical users of AI.
Right.
They need to understand how the algorithms work, be able to interpret their output, know when to trust their own instincts.
So the paramedics of the future will need to be tech savvy as well as clinically skilled.
Absolutely. An exciting challenge, and I'm confident that paramedics will rise to the occasion.
Well, this has been an absolutely fascinating exploration of the Zoll rapid shock algorithm, from its current capabilities to its potential to, revolutionize emergency medicine. As we wrap up our deep dive, is there a final thought you want to leave our listener with?
Well, the integration of AI into emergency medicine is still in its early stages, but it holds immense promise. And I believe we're on the cusp of a new era where technology and human expertise will work together to save lives and improve outcomes for patients. It's an exciting time to be a part of this field, and I can't wait to see what the future holds.
Thanks for joining us on this deep dive into the world of the Zoll rapid shock algorithm. We hope you found it informative and engaging. Until next time, stay curious and keep exploring the frontiers of science and technology. All right, diving in again. Today, we're going to be looking at respiratory distress. Those times when breathing, becomes a real struggle.
Yeah.
We're focusing on 3 conditions: asthma, COPD, and croup.
Okay.
And this is all coming from this paramedic training guide you sent over.
Great.
Now, going through this thing, I got to say, some of these stats really jumped out at me.
Oh, yeah.
Did you know that a quarter of folks in Canada with COPD end up back in the hospital within like 30 days?
Wow, that's a lot.
That's a revolving door I do not want to be a part of. And
Yeah.
then croup.
Uh-huh.
It might sound kind of, I don't know, cute,
Yeah.
but it actually sends a ton of kids under 10 to the ER.
Oh, wow.
It's like the second most common reason. for them.
You don't think about that.
So this stuff is serious business.
Yeah.
So to help us break it all down, I've got our expert here.
Happy to be here.
So let's start with asthma.
Okay.
I mean, we've all heard of it, right?
Of course.
But this training doc really highlights how widespread it is in Canada, like 3.8 million people.
That's a lot of people.
It's like everyone in Montreal is dealing with this.
Wow.
And it costs the healthcare system over $1 billion every year.
It's a big impact.
Yeah, so we often hear about, the symptoms, but what's actually happening inside our airways during an attack.
Right.
This guide mentions 3 key things: bronchoconstriction,
Okay.
airway inflammation, and mucus impaction.
Right.
Can you kind of break those down for us?
Yeah, so picture your airways like a highway system, for air, carrying oxygen to your lungs and taking away the carbon dioxide.
Okay.
But with asthma, those highways get hit with roadblocks and detours and even some serious congestion.
Okay.
So bronchoconstriction is like a lane closure. The muscles surrounding the airways, they tighten, squeeze the passageway, making it tougher for air to flow freely.
So less space for air to move through.
Exactly.
Got it.
Then there's airway inflammation.
Okay.
So picture those highways, but there's construction going on.
Okay.
So the lining of the airways, it gets irritated and swollen, further narrowing the space for air to travel.
So we got lane closures and now construction.
Exactly.
Definitely slowing things down.
Yeah, and as if that wasn't enough, we add in mucus impaction,
Oh, great.
which is like a pileup of debris blocking the road completely.
Oh, no.
Excessive mucus clogs the airways, making it even harder to breathe.
Wow, that's a triple whammy.
Yeah.
No wonder asthma attacks can be so scary.
It's a big deal.
It's like a traffic jam in your lungs.
For sure.
Speaking of scary, this training doc mentioned something called status asthmaticus. What's going on there?
So status asthmaticus is essentially an asthma attack that's gone rogue.
Okay.
It doesn't respond to the usual treatments.
Uh-oh.
It can quickly become life-threatening.
Yeah.
So that traffic jam we're talking about has become a complete standstill,
Okay.
and emergency crews are needed.
All right, so definitely a situation you want to avoid.
I think so.
Really puts into perspective how important early intervention is.
Absolutely.
Now, the guide also mentions something called autopeep, and it warns paramedics about its dangers. What is that, and why is it so concerning?
So autopeep, or autopositive end expiratory pressure,
Okay.
is a complication that can arise when someone is having a severe asthma attack
Hmm.
and needs help breathing. Imagine you're trying to inflate a balloon that's already full.
Okay.
The air gets trapped,
Right.
and it creates pressure.
Yeah.
So in the lungs, that pressure makes it harder for the heart to pump blood throughout the body.
So it's not just the lungs struggling, it's like a domino effect.
Exactly.
That's concerning.
And it can lead to a rapid drop in blood pressure and potentially even cardiac arrest.
Wow.
It shows just how critical it is for paramedics to recognize the signs of autopeep and manage it appropriately.
Yeah, it really makes you realize how finely tuned our bodies are
Absolutely.
and how quickly things can go downhill when
Yeah.
one system gets thrown off balance.
Huh.
Now, while asthma is often the first thing that comes to mind when we think about respiratory distress, there's another condition that impacts a significant number of people,
Right.
especially as we age.
Mm-hmm.
COPD, chronic obstructive pulmonary disease.
Okay.
This guide explains that COPD is actually an umbrella term for 2 main conditions,
Right.
emphysema and chronic bronchitis.
Yes.
Can you tell us a bit more about those two and how they differ?
Okay, so both emphysema and chronic bronchitis cause damage to the lungs and make breathing difficult.
Right.
But they affect different parts of the respiratory system.
Okay.
So think of your lungs like a tree
Okay.
with branches that divide into smaller and smaller twigs,
Yeah.
ending in tiny little leaves.
Okay.
And those leaves are like the alveoli in your lungs,
Okay.
where the exchange of oxygen and carbon dioxide happens.
So the alveoli are where the magic happens.
Exactly.
The real work of breathing.
Yes. Now, with emphysema, those tiny air sacs,
Uh-huh.
they lose their elasticity,
Oh.
they become damaged, and can't hold air effectively,
Oh.
making it much harder to get the oxygen you need and expel the carbon dioxide your body doesn't.
It's like the leaves are wilting and unable to do their job.
Exactly.
That must make breathing so difficult.
Yeah. And people with emphysema often feel constantly short of breath.
Like they can't get enough air.
Exactly.
Okay. And then we have chronic bronchitis.
Yes.
So tell us about that one.
So chronic bronchitis affects the branches of our lung tree,
Uh-huh.
the bronchial tubes,
Yeah.
and it's like a constant irritation and inflammation of those airways,
Okay.
causing them to swell and produce too much mucus.
So with bronchitis, it's more about those airways themselves being compromised
Yeah.
rather than the tiny air sacs.
That's right.
Got it.
So the inflammation and excess mucus make it hard for air to pass through those tubes,
Right.
leading to a persistent cough and that feeling of being short of breath.
It sounds like a miserable combination.
Yeah.
Struggling to get air in because of damaged air sacs and struggling to get air out because of inflamed and mucus-filled airways. Exactly.
No wonder COPD has such a significant impact on people's lives.
Right.
And what's surprising is that COPD might be a lot more common than we think.
Yeah.
While the official stats say about 4% of Canadians have it, This training guide suggests the real number could be as high as 16%.
That's a big difference.
Yeah, and it's often underdiagnosed, particularly in its early stages.
Yeah, it's often missed.
And this is partly because the initial symptoms,
Mm.
like a persistent cough or slight shortness of breath,
Mm.
can be easily dismissed
Yeah.
or attributed to other causes like smoking or aging.
Right.
So it's a reminder that we need to be attuned to changes in our breathing and not just brush them off.
Yeah, definitely.
Early detection and management are key for any respiratory condition.
Absolutely.
And it seems COPD is no exception.
For sure.
This guide paints a pretty sobering picture when it comes to the impact of COPD on the healthcare system, too.
Yeah.
It says that 25% of patients are readmitted to the hospital within 30 days of being discharged.
Wow. And a staggering 11% die within a year of diagnosis.
That's a lot.
Those statistics are really stark,
Yeah, they are.
and they underscore how serious COPD is.
Yeah, it's something to take seriously.
It's a condition that requires ongoing management
Definitely.
and support to prevent complications and improve quality of life.
Yeah, absolutely.
The high readmission rate suggests that there's room for improvement in how we help patients after they leave the hospital,
You're right.
potentially through better education, follow-up care, and access to support services.
All important things.
It seems like we need to shift our focus from simply treating symptoms
Right.
to truly supporting people living with COPD and empowering them to manage it effectively.
I agree.
Now let's move from the world of adults to a condition that commonly affects children. Croup.
Okay.
If you've ever heard that distinctive barking cough,
Yeah.
you know exactly what we're talking about.
You know when you hear it.
It can be pretty alarming for parents.
Oh, yeah, especially in the middle of the night.
So while most of us are familiar with the sound, can you explain what's happening in the airways that creates that signature bark?
Okay, so croup is usually caused by a viral infection,
Right.
and the inflammation that comes with it really focuses on the larynx and trachea, which are part of the upper airway.
Okay.
So the virus triggers swelling in these areas, narrowing the passageway for air,
Okay.
which creates that harsh barking cough
Mm-hmm.
and sometimes a high-pitched whistling sound
Okay.
called stridor when the child inhales.
So it's like the airway is temporarily shrunk,
Yeah,
making it difficult for air to pass through freely.
exactly.
That explains the sound, but it also highlights how frightening it must be for young children.
It can be really scary.
And this guide reveals that croup isn't just a minor annoyance.
Right.
It's actually responsible for 5% of ER visits for kids under 5 in Canada.
Yeah, a lot of kids end up in the ER because of it.
So while most cases are mild and resolve on their own,
Yeah,
some children can develop more serious breathing difficulties
Right.
requiring medical attention.
absolutely.
That's why it's so important for parents to be aware of the signs of croup and know when to seek help.
Yeah, you have to be able to recognize it.
Early intervention is so crucial,
It's a big difference.
especially when dealing with respiratory issues in young children.
Yeah, you don't want to wait.
Now that we have a better understanding of these three conditions,
Okay.
let's delve into how paramedics approach treating them in emergency situations.
Yeah.
This guide specifically mentions two medications, salbutamol and epinephrine.
Okay.
Can you shed some light on what these medications do and how they work?
So both salbutamol and epinephrine are bronchodilators,
Okay.
meaning they help to relax and open up the airways,
Right.
making it easier for air to flow. They're often used in emergencies to quickly relieve those breathing difficulties.
Okay, so they're like first responders.
Exactly.
So salbutamol is what we call a short-acting beta-2 agonist.
Yes.
In simple terms, it works by stimulating receptors in the lungs
Yeah.
that cause the muscles surrounding the airways to relax, creating more space for air to move through.
Right. So it's like telling those constricted airways to chill out and give the air some breathing room.
Okay, got it.
Now, epinephrine, which is also known as adrenaline,
Yeah.
works in a similar way,
Okay.
but it's a more potent drug
Okay.
that also affects the heart and blood vessels. It's typically reserved for more severe cases like a severe asthma attack or a life-threatening allergic reaction called anaphylaxis.
So salbutamol is the first responder,
Right.
while epinephrine is the heavy artillery.
Exactly.
Got it.
It's important to remember that both medications can have side effects,
Right, of course.
ranging from mild things like anxiety and palpitations to more serious complications.
Okay.
But those are more rare.
Right.
Paramedics are trained to monitor patients closely for any adverse reactions.
So it makes you realize that even life-saving medications
Yeah,
come with risks and benefits.
that's true.
This paramedic training guide also highlights a newer treatment
Okay.
that's gaining traction,
Mm-hmm.
especially for managing croup and bronchoconstriction, dexamethasone.
Yeah.
Can you tell us more about this medication?
So dexamethasone takes a different approach than the bronchodilators we just discussed.
Okay.
It's a corticosteroid,
Okay.
which means it works by reducing inflammation
Okay.
rather than directly relaxing those airway muscles.
So it's like while the bronchodilators are clearing the traffic jam,
Oh,
dexamethasone is addressing the road construction causing the backup.
exactly.
Okay.
By reducing the inflammation, it helps open up the airways and it reduces that mucus production.
So it's a more holistic approach.
I think so.
Tackling the root cause rather than just the immediate symptoms.
I agree.
Now, the research on dexamethasone is impressive.
Yeah, it's exciting.
Studies have shown it can significantly reduce hospital admissions for both asthma and COPD.
That's huge.
What's particularly exciting is its effectiveness in treating croup.
Yeah, it really makes a difference.
Giving a single dose to a child with croup can dramatically improve their symptoms and reduce the need for hospitalization.
All right, it's a game changer.
Since we're on the topic of corticosteroids, this guide mentions that dexamethasone is similar to other corticosteroids like hydrocortisone,
Right.
prednisone.
Yes.
Are those medications used for similar purposes?
That's a good question.
Yeah.
So corticosteroids are a broad class of drugs
Right.
used to treat a wide range of conditions.
Yeah.
They all work by suppressing the immune system and reducing inflammation throughout the body,
Okay.
while dexamethasone is becoming the go-to for that acute respiratory distress.
Yeah.
Other corticosteroids like prednisone have long been used to manage chronic inflammatory conditions.
Okay.
So each corticosteroid has its own specific uses and strengths.
So they're part of the same family, but each member has its own specialty.
Right.
I'm curious about the potential side effects of dexamethasone.
Okay.
We talked about the risks with salbutamol and epinephrine, but what about this newer player?
So this is where dexamethasone really shines. The guide specifically mentions that no adverse effects have been observed with its administration for croup.
Oh, wow.
This isn't to say it's completely risk-free,
Right.
but its safety profile in treating croup appears excellent,
Okay.
especially when used for short periods.
That's reassuring, especially for parents already dealing with a sick child.
Yeah, definitely.
Wow, we've covered a lot in a short time.
We have.
Let's catch our breath and recap what we've learned.
Okay.
So we started with asthma,
Right.
which affects millions of Canadians,
Uh-huh.
and it's characterized by that triple threat:
Yes.
bronchoconstriction, airway inflammation,
Yeah.
and mucus impaction.
Right.
We discussed how those factors create that traffic jam in the airways,
Yeah.
making it difficult to breathe.
It's a big problem.
Then we moved on to COPD,
Right.
which includes both emphysema and chronic bronchitis.
Yes.
We learned how those conditions damage different parts of the lungs, making it challenging to get air in and out.
Yeah, that exchange is so important.
We also talked about the concerning statistics around COPD,
Yeah.
highlighting the need for better management and support for patients.
Absolutely.
And finally, we explored croup, the
Right.
common childhood illness that can cause breathing difficulties.
Yeah, and that barking cough.
Despite its relatively benign nature in most cases,
Hmm.
we learned how a viral infection triggers that inflammation in the upper airway,
Yes.
creating that barking cough.
Right.
We also delved into emergency treatments,
Uh-huh.
examining how those bronchodilators like salbutamol and
Mhm.
epinephrine work to open up the airways.
Hmm.
And we got excited about dexamethasone,
It's very
a
promising.
corticosteroid that tackles inflammation
Right.
and has shown promise in treating a variety of conditions,
Mhm.
especially croup.
It's a game changer.
But here's the question, and this is for you, the listener. Even if you're not a paramedic on the front lines,
Right.
how can this information about respiratory distress be helpful in your everyday life?
Well, I think the key takeaways are pretty straightforward and relevant to everyone.
Okay.
First and foremost, it's about recognizing the signs of respiratory distress,
Okay.
whether it's wheezing,
Yeah.
shortness of breath,
Yeah.
a persistent cough, or that telltale barking cough of croup.
Right.
Don't ignore these symptoms.
Okay.
Early intervention is key to preventing those complications and getting the right treatment.
So if you or someone around you is struggling to breathe, don't hesitate to seek help.
Exactly. And
Okay.
that leads to the second takeaway,
Okay.
knowing when to seek medical attention.
Okay.
If symptoms are severe or worsening or not responding to home remedies, don't wait.
Got it.
Reach out to your doctor
Oh.
or head to the emergency room.
Yeah.
It's always better to err on the side of caution.
Especially for parents of young children.
Absolutely.
If your child is having difficulty breathing, trust your instincts and get them the help they need.
Couldn't agree more.
And finally, if you've been diagnosed with a respiratory condition like asthma or
Yeah.
COPD, following your doctor's instructions regarding medications and treatment plans is essential.
Right.
These conditions can be managed effectively,
Yeah.
but it takes consistent care and attention to keep symptoms under control.
And prevent complications.
So it's all about being proactive and informed.
I agree.
Recognizing those signs, knowing when to seek help, and following medical advice can make a world of difference.
Absolutely.
But before we move on to some preventative measures and tips for maintaining those healthy lungs,
Okay.
I want to leave you with a thought-provoking question.
Okay.
Given what we've learned about how common these respiratory conditions are,
Mhm.
what steps can individuals and communities take to promote lung health
Right.
and reduce the risk of developing these issues in the first place?
That's a great question, and it's one that deserves its own deep dive.
It sure does.
But it's a perfect segue into a topic that often gets overlooked. Prevention.
Yeah, we tend to focus on treatment after the fact. But wouldn't it be amazing if we could prevent these conditions from developing in the first place?
Absolutely.
Where do we even begin?
Well, I think most of us know the answer.
Okay.
Smoking is, without a doubt, the leading cause of preventable lung disease,
Right.
including COPD.
Yeah.
It's responsible for about 80% of COPD cases,
Wow.
and it significantly increases the risk of developing asthma and other respiratory illnesses.
So avoiding smoking is a no-brainer.
It's the first step,
If we want to keep our lungs healthy,
for sure.
what about those of us who don't smoke?
Okay.
Are there other environmental factors we should be aware of?
Yes. Definitely air pollution is a major contributor,
Okay.
especially in urban areas.
Right.
Exposure to particulate matter, ozone, and other pollutants
Okay.
can irritate the lungs,
Yeah.
trigger asthma attacks,
Yeah.
and even contribute to developing COPD.
So even if we're not puffing away ourselves,
Right.
the air we breathe can still do damage?
Unfortunately, yes.
That's a sobering thought. What can we do to protect ourselves?
Well, paying attention to air quality forecasts is a good starting point
Okay.
if the air quality is poor,
Yeah.
especially if you have a respiratory condition.
Right.
Try to limit your time outdoors,
Okay.
particularly during rush hour when pollution levels tend to be highest.
Okay. Makes sense.
And if you have to venture out, consider wearing a mask
Okay.
designed to filter out that particulate matter.
I never really thought about checking the air quality forecast before, but it makes sense.
It can really help.
What about the air we breathe indoors?
Yeah, that's important too.
Should we be concerned about that as well?
Absolutely. Indoor air quality can sometimes be worse than outdoor air quality,
Really?
especially in spaces that aren't well ventilated.
Right.
Common indoor pollutants include dust mites, mold, pet dander,
Okay.
and even chemicals released from cleaning products and building materials.
Wow, so many things.
Yeah.
These can trigger respiratory problems, especially for those with asthma or allergies. So it's not just about escaping that outdoor pollution. We need to be mindful of our indoor environments too.
Absolutely.
What can we do to create a healthier breathing space inside our homes?
Well, ensuring your home is well ventilated is key,
Okay.
particularly in areas like the kitchen and bathrooms,
Right.
to help reduce moisture and prevent mold growth.
Makes sense.
Regular cleaning,
Yeah.
vacuuming with a HEPA filter to trap those tiny particles.
Okay.
And using air purifiers can also help remove dust mites and allergens.
So those air purifiers can make a difference?
They can, particularly for individuals with allergies or asthma.
Okay.
And let's not forget about simple things like washing bedding frequently
Right.
in hot water to eliminate those dust mites.
It's amazing how many factors we need to consider.
It's a lot.
When it comes to protecting our lungs,
Yeah.
we've covered the big ones,
Yes.
smoking and air pollution, both indoors and out.
Hmm.
But what about our own personal habits?
Right.
Are there things we can do to boost our lung health and make those airways happy?
So regular exercise is incredibly beneficial.
Oh, really?
It strengthens the respiratory muscles,
Okay.
improves lung capacity,
Mm-hmm.
and helps clear mucus from the airways.
So getting our hearts pumping is good for our lungs, too.
Exactly. It's a win-win.
What about diet? Does what we eat play a role?
It does. A healthy, balanced diet, rich in fruits, vegetables, and whole grains,
Right, the usual suspects.
can provide those antioxidants and other nutrients that protect the lungs from damage.
Okay, good to know.
And staying hydrated is also crucial
Okay.
because it helps thin the mucus, making it easier to cough up.
So all those healthy habits we hear about for overall wellness
Yes.
apply to our lungs as well.
It all ties together.
But I'm curious, are there specific foods or nutrients that are particularly good for lung health?
While there's no magic bullet,
Okay.
Some nutrients have been linked to better lung function.
Okay.
Antioxidants,
Yeah.
like vitamin C and E,
Right.
which are found in fruits and vegetables, can help protect the lungs from the damage caused by pollutants.
Okay. Interesting.
Omega-3 fatty acids,
Uh,
which are found in fatty fish like salmon,
mm-hmm.
have anti-inflammatory properties that could be beneficial for individuals with asthma.
So a Mediterranean diet
Yeah,
with plenty of fruits, veggies, and fish
that's a good start.
could be a recipe for healthy lungs.
I think so.
There's also growing research on the role of vitamin D in respiratory health.
That's right.
Some studies suggest that vitamin D deficiency might be linked to an increased risk of respiratory infections and asthma exacerbations.
Yeah, it's an important area of research.
So soaking up some sunshine could be good for our lungs too.
It seems so.
But before we all rush out to stock up on salmon and sunbathe,
Right.
what about those of us who already have a respiratory condition?
Okay.
Are there specific lifestyle recommendations for managing conditions like asthma or COPD?
Yeah, this brings up a really important point about self-management
Okay.
when it comes to those chronic respiratory conditions.
Yeah.
So for people with asthma, creating an asthma action plan with their doctor is crucial.
Okay.
This plan outlines their medication,
Uh-huh.
helps them recognize those early warning signs of an attack,
Right.
and tells them what to do in case of an emergency.
So it's like a roadmap for navigating life with asthma
Exactly.
and staying ahead of potential problems. And for folks with COPD, pulmonary rehabilitation programs can be really helpful.
Yeah, they can.
These programs usually involve exercise training, education on managing symptoms, and breathing techniques to improve lung function.
Right. And enhance their quality of life.
It's encouraging to know that there are strategies
Yeah.
and programs available to help people take control of their health and live fuller lives.
Absolutely.
Another crucial aspect of managing both asthma and COPD is understanding and avoiding your triggers.
That's key.
This might mean steering clear of smoke allergens,
Right.
or even certain types of weather
Exactly.
that can make their symptoms worse.
It's all about being aware.
So it's a lot of self-awareness and planning,
Yeah,
but I imagine the payoff is worth it
it really is.
in terms of feeling better and preventing those flare-ups.
Absolutely.
Now, while we've touched on so many physical aspects of managing these conditions,
Mhm.
it's important not to overlook the mental and emotional side of things.
Yeah, that's a good point.
Remember that anxiety and stress can worsen respiratory symptoms.
It's true.
So it's not just about managing the physical symptoms.
Right.
It's about managing the mental and emotional ones as well.
Absolutely. Taking care of your mental health is just as important
Okay.
when it comes to those respiratory conditions.
So incorporate stress management techniques,
Yeah.
relaxation exercises, mindfulness, or meditation,
All good things.
and don't hesitate to reach out to a therapist for support.
Exactly.
It sounds like a holistic approach to respiratory health,
I think so.
recognizing that our bodies and minds are connected.
Yeah,
Okay, we've explored a wide range of strategies for promoting healthy lungs,
we have.
everything from breathing exercises and laughter to singing and playing wind instruments.
A lot of options.
But before we wrap up this first part,
Right?
I want to touch on something you mentioned earlier, and that's the importance of finding support.
Yeah.
What advice do you have for people who might be feeling alone?
Well, it's so important to remember that you're not alone in this.
Right.
There are support groups, online communities, and tons of resources out there
Okay.
for people with respiratory conditions and their families.
Yeah.
So connecting with others who understand what you're going through
Mm-hmm.
can be incredibly validating and empowering.
Right.
It can help you learn new coping strategies,
Okay.
share your experiences,
Uh-huh.
and access valuable information and resources.
So sometimes just knowing that you're not alone
Yeah.
can make a world of difference.
Absolutely. And remember, you are your own best advocate.
Right.
Be proactive, do your research, ask questions,
Yeah.
and work with your healthcare team to develop a treatment plan that meets your unique needs.
Great advice. We've covered so much today.
Yeah.
From the science of respiratory distress to practical tips for managing these conditions and promoting lung health.
Right.
What final thoughts do you want to leave our listeners with as we head into the last part of our deep dive?
Well, this might sound simple,
Okay.
but I encourage everyone to just take a moment to appreciate the gift of breath.
Okay.
Notice the rise and fall of your chest,
Yeah.
the sensation of air moving in and out of your body.
Uh-huh.
It's such a fundamental part of life that we often take for granted.
That's a beautiful thought.
Thank you. It's amazing how we often take breathing for granted, isn't it?
Yeah, it's true. We go about our day barely noticing the rise and fall of our chests. But the moment breathing becomes labored,
Yeah.
it's all we can focus on.
Yeah.
So let's talk about how to give our lungs some TLC.
Okay.
Where do we start?
Well, for me, it all starts with awareness.
Okay.
Simply tuning into your breath throughout the day can be really powerful.
Okay.
Just notice that gentle flow of air in and out. It's a way to connect with your body and, cultivate gratitude for this essential function we often overlook.
It's like a mini meditation we can practice anytime, anywhere.
Exactly. And building on that awareness,
Okay.
practicing deep breathing exercises can be so beneficial.
Yeah, I've heard that.
Those deep, slow breaths help expand the lungs,
Right.
increase your oxygen intake, and even reduce stress.
Okay.
There's so many techniques out there,
Yeah.
from diaphragmatic breathing to box breathing.
Right.
Find one that works for you and incorporate it into your routine.
It's amazing how something as simple as changing the way we breathe
I know, it's pretty cool.
can have such a profound impact on our well-being,
Yeah,
both physical and mental.
absolutely.
It's like a secret weapon we all have access to.
And here's another secret weapon I like to use. Laughter.
Oh, I like that.
A good belly laugh is like a mini workout for your lungs.
Okay.
It forces air out and can even help clear out any mucus that's lingering.
Oh, wow.
Plus, laughter is a natural stress reliever.
Yeah.
So it's a win-win for both our mental and respiratory health.
I love that.
Yeah,
Laughter truly is the best medicine.
I think so.
It seems like we're talking about so much more than just avoiding the bad stuff.
Right.
It's about actively engaging in things that make our lungs happy.
That's a good way to put it.
Yeah.
And that brings me to another enjoyable activity. Singing.
Oh, yeah.
Singing is a fantastic way to strengthen those respiratory muscles and improve lung capacity.
So whether you're belting out tunes in the shower or joining a choir,
Yeah,
it's a fun way to give your lungs a workout.
it is.
What other surprising activities can benefit our breathing?
Well, this one might surprise you. Playing wind instruments.
Oh, yeah.
Playing the flute, the trumpet,
Oh,
even the bagpipes.
Right.
Requires controlled breathing and precise breath work.
Right, yeah.
It's like targeted training for your whole respiratory system.
I never thought about it that way, but it makes sense.
Right.
Maybe it's time I pick up a clarinet.
I think you'd be great at it.
And let's not forget about nature.
Yes.
Spending time outdoors, breathing in fresh air,
Absolutely.
surrounded by trees and greenery.
It's like a breath of fresh air for your lungs.
I like that.
Right.
It's a natural way to cleanse your respiratory system
Yeah.
and boost your well-being.
For sure.
So a walk in the park is more than just exercise. It's a lung detox.
I love that.
But what about those of us who are already dealing with a respiratory condition?
All right.
Are there specific lifestyle changes that can help manage conditions like asthma or
Right.
COPD more effectively?
That's a great question. And it highlights the importance of self-management
Okay.
for those chronic conditions.
Yeah.
So for people with asthma, creating an asthma action plan with their doctor is crucial.
Okay.
That plan outlines their medication regimen,
Right.
helps them recognize those early warning signs,
Mm-hmm.
and guides them on what to do in an emergency.
So it's like a personalized roadmap,
Exactly.
empowering them to stay ahead of potential problems.
Oh.
And for individuals with COPD, pulmonary rehab programs can be so beneficial.
Yeah, they can really help.
These programs usually involve exercise training,
Uh-huh.
education on managing symptoms.
Mm-hmm. And breathing techniques to improve lung function
Oh,
and enhance their quality of life.
it's good to know that there are strategies and programs
Yeah.
that can help people take control of their health
Absolutely.
and live fuller lives.
For sure.
Another crucial aspect of managing both asthma and COPD is understanding and avoiding your triggers.
Right. That's key.
This might mean steering clear of smoke allergens
Yeah.
or even certain weather conditions.
That can exacerbate their symptoms.
It sounds like a lot of self-awareness
It is.
and careful planning.
Yeah. But the payoff is worth it.
In terms of feeling better and preventing those flare-ups.
Absolutely.
Now, while we've talked about so many physical aspects,
Yeah.
it's important not to overlook the mental and emotional side.
That's a good point.
Remember that anxiety and stress can actually worsen respiratory symptoms.
That's true.
So it's not just about managing the physical symptoms,
Right.
but the mental and emotional ones too.
Taking care of your mental health is so important
Yeah.
when it comes to respiratory conditions.
So incorporate stress management techniques,
Yeah.
Relaxation, exercises, mindfulness, or meditation.
All good things.
And don't be afraid to reach out to a therapist
Right.
for support if you need it.
Absolutely.
It sounds like a holistic approach,
I think so.
recognizing that our bodies and minds are connected.
Yeah, you've hit the nail on the head.
It's about acknowledging that our lungs don't exist in isolation.
Right.
They're part of a complex, interconnected system,
Yeah.
and supporting that whole system is key
Absolutely.
for optimal well-being.
For sure.
Okay, we've explored a wide range of strategies
Yeah, we have.
for promoting those healthy lungs.
Right.
Everything from breathing exercises and laughter
Uh-huh.
to singing and playing wind instruments.
A lot of different things you can try.
But before we wrap up this part, I want to touch on something you mentioned earlier,
Yeah,
and
yeah.
that's the importance of finding support.
Right.
What advice do you have for people who might be feeling alone in their journey?
Well, it's so important to remember that you're not alone.
Right.
There are support groups, online communities,
Mm.
and countless resources for people with respiratory conditions and their families.
Okay.
Connecting with others who understand can be so validating
Right. Yeah.
and empowering.
Yeah.
It can help you learn new coping strategies, share your experiences,
Hmm.
and access information and resources.
I love that sometimes just knowing you're not alone can make a world of difference.
Absolutely.
And remember, you are your own best advocate.
Yes.
Be proactive, do your research, ask questions,
Yeah.
and work closely with your healthcare team to find a treatment plan that meets your needs.
Couldn't agree more.
We've covered so much today,
We have.
from the science behind respiratory distress to practical tips
Uh-huh.
for managing these conditions and promoting lung health. What final thoughts do you have for our listeners
Look.
as we head into the last part of our deep dive?
Well, this might sound simple,
Okay.
but I encourage everyone to just take a moment to appreciate that gift of breath.
Okay.
Notice the rise and fall of your chest,
Hmm.
that sensation of air moving in and out.
Right.
It's such a fundamental part of life we often take for granted.
Yeah, it really is something we don't think about until it's a problem.
Right.
And that brings us back to the question I asked earlier. What are some small, everyday things we can do to help us breathe a little easier?
Well, we've already touched on a lot of them,
Yeah.
like deep breathing exercises,
Hmm.
getting regular exercise,
Right.
finding ways to laugh and sing,
Hmm.
even playing a wind instrument.
Those all sound great, but what about something even simpler?
Okay.
Something we can do right here, right now.
Okay, how about this?
Okay.
Close your eyes for a moment
Okay.
and take a slow, deep breath in through your nose.
Okay.
Feel your belly expand as you fill your lungs with air.
Mm-hmm.
Hold it for a second or two and then slowly exhale through your mouth.
Wow, I already feel more relaxed.
It's amazing how powerful something so simple can be.
It's like hitting the reset button
Exactly.
from your whole system.
And if you can build that awareness of your breath into your day,
Okay.
even just for a few minutes,
Yeah.
you'll be amazed at the difference it can make.
So we're talking about more than just taking care of our lungs.
Right.
It's about taking care of our whole selves.
That's a great way to put it because everything is connected.
Right.
Our physical health, our mental health, our emotional well-being.
Yeah.
When we nurture one part,
Yeah.
we nurture the whole.
This has been a really insightful conversation. I feel like I've learned so much
Good.
about how to support not just my lungs, but my overall health.
I think that's the key takeaway.
Yeah.
The more we understand about our bodies
Yeah.
and how to support them,
Mm-hmm.
the better equipped we are to live healthier, more fulfilling lives.
Well said. Any final words of wisdom?
Keep breathing.
Okay.
Keep exploring those things that help you breathe easier
Mm-hmm.
and deeper.
Okay.
Keep laughing, keep singing, keep moving,
Yeah.
and keep learning.
That's great advice. Thank you so much for joining us today and sharing your expertise.
Happy to be here.
And to our listeners, thank you for diving deep with us.
Yes, thank you.
We hope you gained some knowledge and inspiration to help you breathe a little easier and live a little healthier. Until next time, keep exploring, and keep breathing.
Sounds good. All right, let's dive in. We've gotten some really fascinating stuff on tension pneumothorax.
Yeah, a serious medical emergency.
We're going to break down the anatomy, the causes,
Yeah.
and the procedure to fix it. Needle thoracostomy.
It's a great topic. And the sources you found,
Yeah.
an audio lecture and an animation,
The animation is really cool.
give us a really solid foundation to start this deep dive.
So let's say you're a paramedic. You get a call.
Mm-hmm.
You find someone who has a tension pneumothorax. What happens next? By the end of this, you'll know exactly how it happens,
Yeah.
how it affects the body, and how those first responders, how they're trained to deal with it. But first,
first.
Thorax Anatomy 101.
Right, like setting the scene. Think about the thorax, like this protective cage around your lungs. You've got the rib cage, the sternum, vertebrae, muscles,
Everything in place.
all working together.
Yeah.
But there's a key element here. The pleural sac.
Yeah, the video, it showed it as this thin layer around each lung, like
Yeah.
almost like a film.
Exactly. And that film is actually 2 layers.
Oh, okay.
So you've got the visceral pleura right up against the lung,
Okay.
and then the parietal pleura, which lines the chest wall.
For 2 different.
2 different layers.
Okay.
And between them
Uh-huh.
is this tiny space called the pleural cavity.
Is there anything in there?
Yeah. So it's not just empty space.
Okay.
There's a little bit of fluid
Yep.
that acts like a lubricant.
Okay.
And so this lets the lungs move really smoothly when you breathe.
Okay, so every breath we take,
Yeah, so without it,
it's not just like friction.
it would be like sandpaper
Oh, wow. Yeah.
rubbing together, yeah.
And each lung has its own separate pleural cavity, right?
Totally. It's like 2 individual units.
Okay.
Which is a really smart design.
Yeah, because if you damage one,
If one gets hurt,
the other one keeps going.
another one can keep working.
That's good. That makes me feel a little better.
Yeah, not an all or nothing situation.
But things can definitely go wrong when this whole system, this really delicate system,
Right.
gets disrupted.
Yeah.
So let's talk about this one-way valve problem that causes the tension, pneumothorax.
Yeah.
I remember in the lecture they used this analogy of like a punctured tire
Yeah.
that has this flap that lets air in but not out.
Perfect analogy.
Yeah.
So instead of a tire,
Yeah, long.
imagine your lung and that air building up in the pleural space. That's the pneumothorax.
Okay.
It starts squeezing the lung, making it harder to breathe.
So what are the bigger picture consequences of this pressure building up? It sounds like it's more than just a breathing problem.
You're right. So if we zoom out a little bit, that increasing pressure starts to press on blood vessels and even the heart itself.
Oh, that's not good.
Yeah.
It sounds like it just has this chain reaction in the body.
Yeah, absolutely. So the pressure makes it difficult for blood to get back to the heart,
So it can't circulate as well.
which means less oxygen is getting to the body.
Okay. That makes sense why it's such an emergency then.
Yeah.
It's not just a lung injury, it's like a circulatory problem.
Totally.
So we've talked about what it is,
Right.
but what causes it? I've always thought of it as like car accidents or stabbings. you know,
Right. Those are definitely some of the those are traumatic causes.
Like the obvious ones.
Yeah, along with rib fractures, right, that can puncture the lung.
Oh, okay.
But what's interesting is that tension pneumothorax isn't always caused by a physical trauma.
Really?
There are medical causes as well.
What kind of medical conditions would cause that?
So think about lung diseases like COPD,
Okay.
where the lungs are already kind of compromised
Yeah, they're not as strong.
and more likely to leak air.
Yeah, okay.
Even things like aggressive ventilation during medical procedures
Oh, wow.
can sometimes cause a tension pneumothorax
So it's not even just like an external injury.
But-
It can be from inside.
from within the body.
That's really interesting. So that brings us to needle thoracostomy.
Yeah.
So like you're the first responder, right? You show up and you see this. What do you do?
It's a pretty intense situation.
Yeah.
So what we do is needle thoracostomy, basically releasing that trapped air.
Okay.
It's like popping the tension, like letting the air out of an overinflated tire.
Okay. Yeah. So it's not a permanent solution, but it's like
Right. It's like a temporary fix to buy some time
just to
to
stabilize
stabilize.
until you can get them to the hospital.
Exactly. Get them to definitive care where they can actually fix whatever the underlying cause is.
But there's a twist here.
there is.
They've changed where they do it.
They have. There's been a shift
Mhm.
in where paramedics are putting that needle.
Oh, the video is very specific. Like there was a spot
It used to be
on
in
chest.
So the old protocol was the second intercostal space,
Okay.
mid-clavicular line.
So like,
So basically, find your second rib, follow a line straight down from the middle of your clavicle,
Okay.
your collarbone,
yeah.
and that was the spot.
Okay. So where are they doing it now?
So the new preferred location is the fourth intercostal space
Okay. Much slower.
along the anterior axillary line. So that's the line that runs right down the front of your armpit.
Mm-hmm.
You find the fourth rib.
Okay.
That's your target.
That's so interesting. Why did they change it? It seems like kind of a big deal.
Yeah. There are a few reasons, all backed by research.
Okay.
So first, putting the needle at the fourth intercostal space It's less likely to get dislodged during transport.
So less chance of it coming out and
Yeah.
then getting the pneumothorax again.
Yeah, plus there's less risk of hitting the liver at that spot.
Okay.
The liver sits right below the fifth rib,
Uh-huh.
so being a little higher up is safer.
Okay. Yeah, that makes sense.
And here's the big reason for the change.
Okay.
Remember how we talked about the pressure? At the second intercostal space, the needle couldn't relieve the pressure in up to 80% of cases.
80%.
80%. But at the fourth intercostal space,
Wow.
the success rate is much, much higher.
That's crazy.
It's probably because the chest wall is thinner there, so it's easier to get to the pleural space.
So it's such a little change,
Yeah.
but it makes such a difference.
Huge difference.
What about kids? Like, how does this procedure change for kids?
That's a great question. For adolescents, like teenagers who are about adult size, it's pretty much the same procedure.
Okay.
But for younger kids,
Mm-hmm.
we got to be really careful about the size of the needle.
Yeah, because their chest is so much smaller.
So much smaller.
Yeah.
Using a needle that's too long
Mm-hmm.
could really hurt those vital organs.
Okay.
The heart and lungs. So
So it's all about the right tools and understanding their anatomy.
exactly.
Yeah.
And with kids, it's super important to use a gentle technique
Okay.
and aspirate.
Okay. Aspirate. Now, what does that mean?
So that means like drawing back on the syringe
Oh, okay.
as we're putting the needle in.
Mm-hmm.
This helps us avoid like poking the lung or the diaphragm.
Gotcha. So it's a very delicate procedure,
Yeah. It's simple.
even though it seems so simple.
And in theory, there's a lot to it.
But it's got these nuances that we got
Yeah.
to pay attention to.
And even when you do it right, even when it's successful,
Right. It's just the beginning.
it's not over.
There are still risks of things going wrong.
Like what can go wrong?
So, like, during the procedure itself,
Mm-hmm.
there's always a chance of, poking the lung or diaphragm,
Mm-hmm.
causing some bleeding,
Mhm.
even hitting those nerves that run along the ribs.
And infection has got to be a big concern anytime you're, breaking the skin there.
Absolutely.
Yeah.
Anytime we're putting a needle through the chest wall, infection is a huge risk.
Okay.
And here's a tricky one.
If we get the diagnosis wrong, like if it wasn't a tension pneumothorax in the first place, doing this procedure could actually give them a pneumothorax.
Oh, wow. That's a big deal. So being sure of what you're seeing.
Yeah, you got to get it right.
Right.
That initial assessment is crucial.
Yeah. And because of all these risks, you got to keep a really close eye on the patient afterwards.
Absolutely. It's not a one-time thing.
Mhm.
We're constantly reassessing.
Okay.
Their condition can change really quickly.
Okay, so like what does that look like? Like how are they monitoring them?
So we're constantly checking their vital signs.
Okay, so their heart rate, their breathing,
Heart rate, blood
blood-
pressure.
blood pressure, breathing rate, how much oxygen is in their blood.
Yeah.
We're also listening to their lungs,
Okay.
making sure things are getting better.
They're improving, not worse.
Not worse, yeah.
And all this is happening while they're driving to the hospital?
While they're in the ambulance,
Yeah.
That's intense. Like they're doing this in a moving vehicle.
It's a very dynamic situation
Yeah.
that demands, top-notch skills and constant attention from these paramedics.
Yeah, that's a lot to
God.
juggle. And
Yeah.
and remember,
Mm-hmm.
needle thoracostomy, it's just buying us time.
It's not fixing the problem.
It's not addressing the root cause. It's
Wow.
just making sure they're stable enough to get to the hospital
Mm-hmm.
to get that definitive treatment.
So what happens when they get to the hospital?
So at the hospital, they'll do a more thorough workup.
Okay.
They'll do imaging,
Mm-hmm.
like an X-ray or a CT scan to see what's really going on.
Okay, yeah. They'll get a better picture.
From there, they can figure out how to fix the problem,
Mm-hmm.
whether that's surgery to fix a tear in the lung
Okay.
or treating an underlying lung disease like COPD.
So it's really a team effort then.
Oh, absolutely.
Like it starts with the paramedics.
Paramedics are the first link in the chain.
Yeah.
Then it's handed off to the hospital team. And COPD, that's not just like a quick fix.
No, COPD is a chronic condition. It needs long-term management.
Yeah.
And one of the main ways that COPD can cause a tension pneumothorax is through these things called bullae.
Bullae, what are those?
So imagine tiny air sacs in the lungs.
Mm-hmm.
They get overinflated and they form these little blisters, like pockets.
Okay.
These bullae, they're really fragile
Mm.
and they can rupture leaking air into the pleural space.
And that's what causes the tension pneumothorax.
Exactly.
So their lungs are already kind of
Yeah,
like on the verge.
walking on eggshells.
Yeah, that's a good way to put it.
You got to be so careful to prevent complications like this.
So we've gone from the anatomy
Right from the basic
to the emergency treatment.
to the long-term care.
It's a whole journey.
It is. What are some of the big things that
Yeah.
you think our listener should really take away from all this? Well, first of all, I think understanding how a tension pneumothorax works. It's not just a hole in the lung. It's life-threatening. It affects the whole body.
Yeah, it throws everything off.
What about you? What really stands out to you?
I think the variety of causes.
Yeah.
Like, it's not always a traumatic injury. It can be medical.
Medical problems.
Yeah, so that expands, like, who's at risk.
Yeah, that's a great point.
Mm-hmm.
And I think we've both learned a lot about needle thoracostomy.
Oh, yeah.
It's such a precise procedure, and it really can save lives, but you got to keep watching them afterwards.
Keep watching.
Even if it goes well.
Not over.
Yeah.
It's not over.
And this deep dive, it focused on that immediate emergency response. But there's a whole other side to it.
Right, we got to think about.
Like what causes it in the first place.
Yeah, like the long-term management of the underlying causes.
Yeah.
Yeah, it makes you think, like, what are they doing to, like, actually prevent this from happening?
Right.
Like, are there new treatments, new,
Absolutely.
ways to manage those conditions?
Yeah, there's so much research going on, looking at ways to better manage lung diseases like COPD,
Okay.
and even developing new surgical techniques for lung repair.
Like less invasive, right?
Yeah, minimally invasive.
That's amazing.
Yeah, it's incredible how fast medical science is advancing.
It makes you wonder, like, maybe someday they won't even need to do needle thoracostomy.
Right, maybe they'll have something better.
Yeah, something that just, fixes it.
Some kind of new technology or treatment. But for now,
Yeah, for now. Yeah.
needle thoracostomy is still a vital tool
Yeah.
for those emergency situations. And understanding it, like we've been talking about, can really make a difference.
Yeah, knowing what to do, when to do it.
Absolutely.
Well, I think we've given our listener a lot to think about.
Yeah, we've covered a lot of ground.
We started with the anatomy, then we talked about tension pneumothorax, what causes it,
The different causes,
what it does to the body,
how it affects the body.
and then that life-saving procedure, the needle thoracostomy.
Yeah, and all those little details, the steps, the complications,
Yeah, it's a lot more complex than I
Than
think
this.
I realized. But I think the biggest thing is just realizing how skilled those paramedics are
Oh, absolutely.
who respond to these emergencies. Like, they're amazing.
Yeah, they're highly trained,
Yeah.
and they're dedicated to saving lives.
So, to our listener, we hope you learned something new today. Keep exploring, keep researching. Maybe you'll be the one to come up with the next big treatment.
Yeah, the future of medicine is wide open, so keep diving deep.
And until next time, we'll see you on the deep dive.